Sri Lakshmi and Dr. Krishna Priya. And I invite our Kaumari Bhritya panel, Dr. Arati Dinashekar, Dr. Sulada Nandakumar, and Dr. Rajneesh. Next, I invite Kai Chitsa panel, Dr. Ramesh P, Dr. Bhagya Soman, and Dr. Kavita Raj. Now, I would like to invite our Shalakya Tantra panel, Dr. Dilendra Thopale, Dr. Vaishak Raj, and Dr. Arya K. Panikar. Next, I invite Dravya Guna panel, Dr. Vishwanand Patil, Dr. Srideka, and Dr. Kalyani. And I invite Shadli Tantra panel, Dr. Arun Krishnan, Dr. Krishnananda Siya, and Dr. Usha. Next, I invite Panchakarma panel, Dr. Jinsi Joseph, Dr. Mahesh, and Dr. Ashwini Somsundaram. Now I invite our Samhita panel, Dr. Ramadevi S. and Dr. Kavita Spajish. And I would like to invite our Rasabarshija panel, Dr. Remyaji, Dr. Sindhu Lashmi. And finally, I invite our Rajna Sharida panel, Dr. Vivek, Dr. Sri Lakshmi, and Dr. Krishna Priya. So now we can start the session. First of all, we have a poster presentation, and I invite Dr. Nikhil Shyam Sundar Agarwal for the presentation. I invite Dr. Nikhil Shyam Sundar. So next I invite Dr. Nabeel Ashar Shakeel. So next I invite Dr. Nabeel Ashar for the paper presentation. Dr. Nabeel. Now I invite Dr. Sinchan for the paper presentation. I invite Dr. Sinchan for the paper presentation. Hello, doctor.
Hello.
You are audible, doctor.
Okay. I'll share my PPT. No.
Dr. Sinchan.
Hello. 1 minute.
Please share your PPT.
Is it visible? Hello.
It's not visible, doctor.
Okay. Now?
No, doctor.
Okay, I'll present after 5 minutes, please.
Okay, doctor.
So next I invite Dr. Dileep. I invite Dr. Dileep for the paper presentation.
Am I
Dr.
audible?
Dileep. Yes, doctor.
Yeah. Okay. Whether slides are visible, madam?
Yes, doctor, it's visible.
Okay. Myself, Dr. Dileep from the second year PG Scholar, Department of Kaya Chikitsa from SDM College of Ayurveda, Udupi, guided by the Dr. Shailesh Vai, Assistant Professor, Department of Kaya Chikitsa and Manasaroga, SDM College of Ayurveda, Udupi, and under the valuable guidance of HOD, Department of Kaya Chikitsa and all the faculties in Department of Kaya Chikitsa and Manasaroga. My topic is on case presentation on Ayurvedic management of hemorrhagic stroke with the TENIA corporis. Rogi Nama Manorama, Vaya 74 years, Linga female, Jati Hindu, Shaikshanika Ruttanta primary education, Vyavasaya housewife, Vaivahika Sthiti married, and patient came with a complaint of reduced strength in the left half of the body associated with the right-sided deviation of mouth since 2 months. Associated complaints are a tinea infection since 1 month. Vedana Ruttanta, a female patient of age 74 years, known case of hypertension since 2 years, but not on regular medication, and also known case of depression since 14 years and on regular medication or otherwise said to be healthy before 2 months back. And on November 11th, 2021, around 6:30 p.m., patient was speaking in a phone and suddenly felt giddiness and weakness and collapsed on the floor. During this time, none of the family members were present at the home until 8:30 p.m. She was in the same place. She was not even able to get up by her own. Then her son, after returning from work, noticed that his mother was not opening the door in spite of the ringing the doorbell. So he opened the door with his spare key and saw his mother lying on the floor and immediately shifted her to the hospital. Then she gradually went for unconscious state for the whole night and regained consciousness on the next day in disoriented and irrelevant speech. Later on, there was a loss of complete strength in the left half of the body and and was not able to stand, walk, or to do her work, daily activity on her own. Associated to this, she had deviation of her mouth towards the right side and was finding difficult to chew the food and hold the water in the mouth. Later after the course of stroke treatment, she improved with her speech and functioning of the mouth and also regained some amount of power in her left lower limb, but with no changes in her left left upper limb. For further management, she got admitted to our hospital on 15/3/2022. Purva Vyadhi Vriddhanta. She is known case of depression since 14 years and she had no history of trauma or any injury, no history of surgery, no history of any other systemic illness. Kautumika Vriddhanta. No similar complaints observed in her family and all are seem to be healthy. On Chikitsa Vriddhanta, tablets F1 500 mg 1 BD and tablet Renew Plus 1 OD and tablet Nexito half HS and tablet Nortimer 1 HS and tablet Ventab DXT 1 OD. Candid cream for external application. Artha Vriddhanta. Menopause attained at the age of 49 years. Prasav Vriddhanta. Number of delivery are 3 and all are normal delivery only. Sarvadehika Pariksha, Karyadesha Pariksha, Atura Bhumi Desha, Desha Anupadesha, Atura Deha Desha Pariksha, Prakriti, Vata Kafaja Prakriti, Vikriti Pravara, Sattva Madhyama, Sara Astisara Purusha, Samhanana Madhyama, Pramana 160 cm, Bhara 48 kg, Satmya Madhyama, Ahara Shakti Madhyama, Jarana Shakti Madhyama, and Vyayama Shakti Madhyama, Vaya Vriddha and Kosta. Madhyama Kosta. And Samsthana Pariksha on central nervous system examination done after the 5 days of treatment. Higher mental functions shows consciousness are fully conscious, orientation to time, place, person are oriented, memory recent are intact, remote and immediate intact, intelligence was good, and speech was low pitched and continuous. Presently no dysarthria, no dysphonia or no aphasia. Handedness, right-sided, hallucination, delusion and illusions are absent. Mood, depressed, insight present. On cranial nerve examination, olfactory nerve, smell sensation intact, no anosmia, optic nerve, visual activity, visual field, color vision, within the normal limit. Oculomotor, trochlear, abducent, all eyeball movements are possible. Pupil position are centrally placed. No nystagmus, no ptosis, no squint. Trigeminal nerve, sensory part is not affected. Motor part within the normal limit. Facial nerve, eyebrow rising possible with a symmetrical presentation of wrinkles on her forehead. No smiling. On smiling, nasolabial folds are symmetrical. On clenching the teeth, slight deviation of the mouth towards the right sided. Blowing of the cheeks, slightly leaking of air is observed. Vestibulocochlear nerve, Weber's test, lateralization to the right sided. Rinne's test, bone conduction is greater than air conduction in left side and right side are normal. Bone conduction is greater than air conduction in left side and right side seem to be normal. Glossopharyngeal and vagus perception and production of the sound, vulva and position within the normal limit. Accessory nerve, shrugging of the shoulder is possible presently. Hypoglossal nerve, no wasting of the tongue, no deviation, all movements of the tongue are possible. Motor system, gait, hemiplegic gait was observed. Tone was hypertonic and power is observed in upper limb right sided 5 out of 5 and left side 1 out of 5, and lower limb right side 5 out of 5 and left side 3 out of 5, and reflexes are right sided bicep 2 points and left side also 2 points, triceps 1 point and left side also 1 point, knee joint 2 points and 3 points, ankle joints 1 point and 1 point. Sensory examination, touch, pain, pressure, vibration present with a superficial and deep. Proprioception, graphesthesia, stereogonesis are 2 points or discrimination intact. Coordination test, dysdiadokinesiae, Romberg's test, finger nose test, heel shin test within the normal limit. Cardiovascular system seem to be S1, S2 are heard and no added sounds. Respiratory system, normal vesicular breathing sound is heard, no added sound, no nasal blockages. Gastrointestinal system, tongue is not coated, abdomen is soft and no tenderness, and there is no organomegaly. Nidana Panchaka, Nidana, Jara, Wruddhapya, Shonita Dushti, Atichintana, Purva Rupa, Avyakta, Rupa, Karmakshaya, Chestahani in Ardha Sharira, Moha, Brahma, Ardita. Samprapti Gatakas, Dosha, Vatapradana Tridosha, Dhatu, Rasa Rakta, Mamsa Asti, Upadhatu, Shirasnayu Kandara, Agni, Avishesha, Ama, Avishesha, Srotas, Vatavaha, Rasaraktavaha, so Sroto Dushti, Sangha, Adhisthana, Udbhavasthana, Pakvashaya, Adhisthana, Shiras, Vyaktasthana, Ardha Sharira, Sancharasthana, Sarva Sharira, Rogamarga, Madhyama Rogamarga, Upashaya, Aushadha, Snehana, Svedana and Basti, Anupashaya, Atichintana, Avyayama, Vegadharana. And on investigation which is done on 15/11/2021 of CT brain was taken. In that the findings were subcutaneous hemorrhagic of the about 2.5 into 1.4 centimeter in the right thalamocapsular region, focal extension in the right cerebral peduncle associated with mild perineal edema causing mass effect on underlying parenchyma and third ventricle, bilateral periventricular white matter ischemia. Vyadhi Chedaka Nidana for Pakshagata, Margavarnajanya Shiromarma Pigataja Pakshagata, Charakokta Ardita, Shonita Dustijanya Shiromarma Pigataja Pakshagata. Differential diagnosis for CVR, transient ischemic attack, transient ischemic attack, ischemic stroke, hemorrhagic stroke. Vyadhi Vinishchaya, Shonita Dushti Shiro Marma Abhigataja Pakshagata or hemorrhagic stroke and with a depression, Vishada and the Tinea corporis. Upadrava are absent. Arishta Lakshanas are absent. And Sadhya Sadhyata Kruchra Sadhya. Chikisa Sutra, Samanya Vatavadi Chikisa, Kevala Nirupastamba Rado, Sneha Rupacharet, Vayu Sarpi Vasa Taila Majja, Pivet Paner Narastata, Sneha Karante Samasakya Pibet Snehat Puna, Vishagramer Ambura Punaresva Sneha Samyuktam. Treatment given to that patient, Mrudu Abhyanga with Sahacharadi Taila to hold the body, followed by Bashpasveda, and Nasya with Anutaila, Dupana with Vachachurna, Dashamula Kashaya Basti on 3rd, 4th and 5th day, followed by Matra Basti with Mahanarana Taila for all 7 days, and capsule Shilajatu 2 TID was given. Ashtavarga Kashaya 5 ml plus Panchagavya Grita 3 ml TID before food was given. Balarista 10 ml TID, Ekanga Virarasa 1 TID, and Lashanadi Vati 1 TID. For Dadru, Gandhakarasayana 2 TID was given, and tablet Krimi Kutara Rasa was 1 TID was given, and Jaffa as lotion for external application in TENIA. And Patya followed in the Pakshagata patient. The Patya is Yava, Guda, Mamsarasa, Abhyanga, Svedana, Ati Chintana, Shrimpinek, and Pisti. Thank you. Am I
Thank you,
audible?
doctor. Yes, doctor, you're audible. Thank you.
Okay.
Thank you, doctor.
So
Okay.
next I invite Dr. Kalpesh Mahendra. I invite Dr. Kalpesh.
Hello, ma'am.
Yes, doctor.
I will be
You're
sharing my
audible.
screen.
It's visible now. Please start.
Yeah. Let me introduce myself. My name is Dr. Kalpesh Mahendra Patil. I am the PG student, 3rd year, Shalyatantra Department, Dr. G.D. Port Foundation, Kerala Medical College, Navi Mumbai. My guide name is Dr. Sanjeev Rangrao Yadav. He is the Dean and Professor of the respective college. My title, Ayurvedic Management of BPH, it is Ashtila. Let me give an introduction regarding the topic I will be presenting. Ashtila, it is one of the 13 types of Mutraghat, the obstructive uropathies described in Ayurveda. It is a mobile and elevated swelling which obstructs the passage of urine and feces. Generally, Vat Prakopa Kahar and Vihar aggravates Vat dosh, which leads to Ashtila, which can be considered as prostate gland enlargement. Then second, benign prostatic hyperplasia, BPH. It is the stromal glandular hyperplasia within the prostatic gland. This condition may or may not be associated with symptoms. So the symptoms which can be found are lower urinary tract infections, then anatomic enlargement of the prostate, or compression of urethra with compromised urinary flow and bladder outlet obstruction. Then the prevalence of BPH. So nearly 10% of men in their 30s, 20% of men in their 40s, 50% to 60% of men in their 60s, and 80 to 90% of men in their 70s and 80s. Then Apan Vayu, it is located in the Pakwadhan and traverses to the Shroni, Basti, Medra, Uru. This is the sthan of Apan Vayu. So the karma is, it helps in the elimination of Samir, Shakrut, Mutra, Shukra, Garbha, Artav. So the reference is from Ashtang Hruday. Then the case presentation. So there was this 54-year-old male patient which came in OPD by reference for urinary complaints since 8 months with no current management. He had no previous medical or surgical history, no addiction history, no allergy history. The patient was examined. The GC was good, vitals were stable, and the chief complaints of the patient was an increased frequency of micturition, urgency for micturition, hesitancy before micturition, and dribbling micturition, and reduce in the stream of urine, occasional dysuria, or sometimes burning micturition. Examination, the PR examination was done. So PR examination was normal, and specifically for prostate, the prostate was on palpation enlarged and non-tender. Then the urine routine was done urgently to rule out UTI. So urine routine came to be normal. The management, so Shodhan and Shaman Chikitsa was done. For Shodhan Chikitsa, firstly, Sarvanga Snehan Swedan, then Basti with Dashamul Tel and Dashamul Kwat for 8 days was done. For the Shaman, for the Shodhan of Apan Vayu specifically. And after the 8 days, patient was advised for the Panchatikta Grut Matra Vasti, 20 ml daily for 7 days. So the complete Shodhan procedure was done for 15 days. And along with the Shodhan Chikitsa, Shaman Chikitsa was started with Gokshuradi Gogud and Varunadi Kwat. So with the Shodhan Chikitsa, we were trying to manage the Apan Vayu, and with the Shaman Chikitsa, we were trying to control the urinary system by managing the urinary problems. Then after a total of 15 days, during the period where we were managing the patient, the gradual improvement in his symptoms was found. And after the 15 days, he was feeling better than when he came to the hospital. So discussion regarding the points. So Apan Vayu, it is the site where the prostate and lower diseases resides. So the normal function of the Vayu is to eliminate the flatus, feces, urine, Shukra, Garbha Nishkraman, Artav. The Mutra Nishkraman is performed by the collaboration of Saman, Pran, Vyan and Apan Vayu. So the Vyan Vayu performs the contraction of the muscles and movement of the waste material. And finally, Apan Vayu helps in the elimination of urine. So if the Apan Vayu has the Pratilom Gati, then we have to make the Gati Anulom, so that Apan Vayu will go in Anulom Gati and the obstruction of the urine will be ready. So obstruction of the urine after relief, it will make the patient devoid of symptoms. So the Vatanunaman was the chief philosophy behind the treatment of the patient. Then Ayurvedic management of prostate involves the pacifying aggravated Vat by Anuloman, strengthening the urinary system by Anuvasan, and relieving the symptoms of prostate enlargement. It can also facilitate shrinkage of prostate, leading to an enlarged quality of life for the patient with this condition. Thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Rajesh. I invite Dr. Rajesh Sambhajirao Deshmukh.
Yes, ma'am.
Dr. Rajesh, please start.
Yes, ma'am. Yes, ma'am.
It's visible, doctor.
Hello.
It's
I am
visible.
Dr. Rajesh Sambhajirao Deshmukh, PG scholar Agat Tantra. My today's topic is role of Ayurveda through use of various Agadas in the management of cancer. Cancer is the second largest cause of death after the cardiovascular disease in the last 3 decades. There are so many deaths of many actors, actresses are caused in the recent years cause of cancer. What is cancer in Ayurveda? Ayurveda, the many resembling clinical features with names such as Apachi, Gulma, Granthi, and Arbuda. In Atharvaveda, cancer was nomenclature as Apachit. The ancient Ayurvedic classics are aware of the clinical features resembling the cancers. Role of Ayurveda in the cancer. There is an adjuvant or co-therapy along with the other chemotherapy or the radiotherapy. It also in Ayurveda Ayurvedic therapies are also useful to slow the progress of cancer. It is also useful and it has an action of anti-tumor action with the help of herbal or herbo-mineral compounds such as Agadas are also useful in the treatment of the cancer. Also the use of Rasayan therapy to improve the quality of life. Ayurveda in cancer management, it is as a prophylactic, as a palliative, as curative, as a supportive treatment to improve the quality of life, as a dietary advice. Cancer, there are different kinds of cancers. Some cancers of lungs, some cancers of which are most common is the breast cancer in the women, also the cancer of colon in the males. Features and causes. There are main features of the cancer are they are unwanted,
Hello, excuse me,
uncontrolled,
doctor.
slow growth anywhere in the body,
Doctor,
deep-seated, non-separating,
Dr. Rajesh.
painless bleeding. Yes, ma'am.
Dr. Rajesh, your slide is
Hello.
not moving.
Hello.
Dr. Rajesh, your slides not moving. Still in the first slide.
Yes, ma'am.
Yes, doctor. Now it's showing the features and causes. Dr. Rajesh.
Yes, ma'am. Hello. Am I audible, ma'am?
Yes, you are audible. Yes, it's visible now. Please continue.
Okay. Now my screen is where the screen is. We were not.
Yes, doctor, it's visible now.
Okay. Thank you, ma'am. What are the main features, ma'am? Should I start from the first or should I continue it?
Please continue, doctor.
Okay, ma'am. The main features of the cancer are basically it is unwanted. Obviously, the cancer is unwanted, uncontrolled, slow growth anywhere in the body. It is a pain. Sometimes there is a painless bleeding. The basic causes, there are so many basic causes which are in Ayurveda we will call it as ahara, vihara, ahit ahara basically. Some occupational exposure, use of certain medicines having carcinogenic effect, air or water pollution may also the cause of cancer. Continuous contact with the chemical or mechanical irritants like sunlight radiations. According to the Ayurveda, the imbalance of three doshas, Vata, Pitta, Kapha, is the root cause of the all diseases and also the cause of cancer. There are some symptoms in modern concept like fever, pain, indigestion problems or trouble swallowing, fatigue, skin changes, and the most probable sign is unexplained weight loss. Ayurvedic management, the main objective of the Ayurveda is the Swasthya Rakshana Raturastha Vikara Prashamanam. The treatment is based on this principle is surgery, various procedures like Snehana, Svedana, Vaman Virechana, Nasya, Basti, Kshar Karma, Rakta Mokshana. The conservative treatment, all the various procedures we have just looked that are the Shodhana Chikitsa, and the other treatment part is the conservative treatment, that is Shamana Chikitsa. Herbal, herbo-mineral processed metals like zinc, copper, iron are widely used. Looking into this, the part of Agadas, we will also use as a conservative treatment for the Agadas. With this, we will conclude with, we will continue with it. Do's and don'ts. Dosha balancing, use of Agadas for dosha balancing, Panchakarma medicine, Rasayana. Dhatu specific is Panchakarma medicine, Rasayana. General concept of
Dr.
management,
Rajesh.
Ayurvedic medicine include advice on diet, special diet, specific Ayurvedic
Dr.
medications,
Rajesh?
herbal medicine, massage. Yes, ma'am.
Doctor, your slide is not moving. It's
Sorry,
now
ma'am.
it's showing the features and poses only.
Sorry, ma'am. I am just give me some minutes. Actually, ma'am, the technical issue.
It's okay, doctor.
Now it is visible, ma'am.
Yes, it's visible and it's showing general concept of management.
Is that visible, ma'am? Hello.
Yes, doctor, it's visible.
Okay, ma'am. In all type of cancer, Visha, in all type of cancer, Visha is present in the form of ama. As compared to the Ayurveda, we will also call as ama. So the initial or first line of management of all type of cancer is ama niraran. With the help of Langana Pachana or the Shodhana are the treatment for Alpa, Madhya and Prabhuta dosha respectively. Ayurveda could offer the symptom management as per need. Matlab symptomatic treatment we will give. Management of side effects of the chemo or radiotherapy as adjuvant therapy. Improvement of quality of life as a rasayana therapy we will use it. Some general measures to improve the quality of life, the palliative treatment. We will add the lifestyle improving therapies. Some Ayurvedic modulations like Ashwagandha Churna, Ayurvedic Churna, which are beneficial measures to improve the life. There are different other formulations which are useful like Vilvadi Gutika, Kalyanaka, Ajita Gruta, Malatyadi Agat, Vilvadi Dushi Vishari Agat, Bunimbadi Agada, Shirish Punarnava, Tulasi. These are also useful. Some beneficial single drugs like we are known since the last COVID era. Guduchi, Haridra, Lasuna, Shigru, Adraka, Talispatra, Ashwagandha, Krishna Jirak, Bhallataka, Haritaki, Devadaru. There are some compound formulations such as Chavanprash, Bhallatak Rasayana, Brahma Rasayana, Trifala Rasayana, which are more useful in as a co-therapy. Some other formulation used in treatment of the cancer. For example, in bone cancer, there's Abha Gugul, Madhu Malini Vasantaras. In the breast cancer, there is a Chincha Ballataka, Jivaniya gun also useful in the breast cancers. In the skin cancer, there is the most role of the Manjista. Another one is a most effective drug we will use commonly, the Samir Pannagrasa. There is a Patya and Apatya, the do's and don'ts, which we will advise to the patient. In do's, the patient must have to carry the most probably the vegetarian diet, plenty of fruits, living in the healthy atmosphere. Observing the mental peace is the most basic thing which we would like to advise the patient. Apatya, the don'ts, the highly processed food with the pesticides contamination, meat, tobacco, which is the most common cause of the cancer, alcohol must be avoided. Occupational exposure to polluted air and water. Discussion. Nowadays there are various environmental factors causing the cancer, such as pollution, food, foundation, perfume, hairspray, products such as shampoo, lipstick, hair dye. There are many common causes which can causes the cancer. We will call it as a dushi. We will see it like a dushi visha as a perspective of the agada, and we will treat it. The three major constitutes important to maintain the physical and mental health are ahara, aushadha, vihara. Aushadha we will be conclude like an conservative treatment. Conclusion: Nityam hita ahara vihara sevi samikshakari vishekshasaktaha data samaha satyaparaha kshamavana apto sevi cha bhavatya rogaha. By maintaining the optimum level of the tissues, it helps to provide the good immunity to healthy person. In diseased person, the rasayana dravyas acts at the level of SROTAS as a channel, as does help in the breaking the pathogenesis of disease by removing the vitiation of the body channels. The causal factor will be one of the three doshas that is prevented from correct the functional communications due to the lifestyle habitats, diet, and the secondary effect of the medications, environmental chemicals, or the psychosomatic reasons. These are some references which I would like to share. At last, the art of medicine is to bring the comforts, and it is an art of loving and kindness. Thank you. Thank you for giving me a chance to present
Thank you,
this.
doctor.
Yes, thank
So
you, ma'am.
thank you, doctor. So next I invite Dr. Sinchan.
Hello.
Doctor, you are audible. Please share the screen.
Yes.
Dr. Sinchan,
Yes, sir.
can I share for you, doctor?
Actually, I'm unable to share.
Okay, doctor. I will share for you, doctor.
Okay.
Doctor, is the screen is visible, doctor?
Yes, sir.
Okay, doctor. Please start the session, doctor.
Okay, sir. Thank you. Good evening, all. Myself, Dr. Sinchan, second year PG scholar, Department of Rachna Sharira, Shiva Yogeshwara Rural Ayurvedic Medical College and Hospital, Inchal. Today, I'm going to present on the topic MASANUMASIKA GARBHA VRIDDHI under the guidance of my HOD and Professor, Mr. M.R. Patil. Reproductive system has important role to play in propagation of species. Detailed explanation of Garbha is explained in Brihatrayi as Shukra Shonita Jiva Sanyoge tu Kalu Kukshigate Garbha Samnya Bhavati. According to Ashtanga Hridaya, it's told whatever doshas are predominant at time of fertilization of ovum, Garbha will be formed of same dosha predominance or Prakriti. Here in this presentation, stage-wise development of Garbha is mentioned along with the modern correlation. Coming to the first month, Tatra Pratame Mase Kalalam Jayate, as told by Sushruta. Charaka mentions as Ketaha Shleshma Tena Keta Boto Iti, Shleshma Sadrisha Ityartaha. In the modern view, after a woman ovulates and meets the sperm, the egg is normally fertilized within 24 to 48 hours. This process leads to conception and woman gets pregnant. By the end of this month, baby is 4 to 5 mm long and the lungs, stomach and liver start to develop. Towards the end of the month, heart, digestive system, backbone and spinal cord begin to form. Coming to the second month. So next slide. Second month. Dvitiye masi ganaha sampadyate pindaha peshi arbudam va tatra ganaha purushaha peshi stri arbudam napumsakam. As told by Charaka, coming to the modern view, at the 6th week, heart will be beating, brain and cranial nerves will also begin to form. Eyes, nose, lips, tongue, ears and teeth are forming. The arms and legs are well formed. Penis begins to appear in boys. Baby is 24 to 30 mm long and weighs about 1 to 2 grams by the end of this month. Coming to third month, Tritiye Hastapada Shirasam Panchapindika Nivartante Anga Pratyanga Vibhagascha Sukshmo Bhavati. Coming to the modern view, by the end of 12 weeks, the baby's face is well formed. Baby's sex organs continue to develop, but it is still too difficult to differentiate the gender. Her nails start to develop and earlobes are formed. The arms, hands, fingers, legs, feet, and toes are fully formed. Baby has developed most organs and tissues. At the end of 12 weeks, the baby is 60 to 70 mm long and weight is about 12 to 14 grams. Coming to the fourth month, Chaturthe Anga Pratyanga Vibhaga Pravyakto Garbhascha Stiro Bhavati, as mentioned by Ashtanga Sangraha Sharirasthana second chapter. Coming to the modern view, baby starts developing the Baby starts developing the reflexes such as sucking and swallowing. Sweat glands are forming on palms and soles. Fingers and toes are well defined. The baby's fingers and toes have fingerprints. Gender is identifiable. Skin is bright pink, transparent and covered with soft downy hair. The baby at this stage is about 12 centimeters long and weight is about 110 grams. Next, coming to the fifth month, Panchame Manaha Pratibuddhatara Bhavati, Mamsa Shonitopachayascha, as mentioned by Ashtanga Sangraha. Coming to the modern view, the mother begins to feel fetal movement called quickening. Hair begins to grow on baby's head. Soft woolly hair called lanico covers baby's body. Some may remain until a week after birth. The baby can be start sucking a thumb, yawn, stretch, and make faces. Ears are well developed as well and may be able to hear. Internal organs also start maturing. Eyebrows and eyelids and eyelashes appear. By 20 weeks, the baby is about 16 centimeter long and its weight about 300 grams. Coming to the 6th month, षष्ठे मासे गर्भस्य बलवर्ण उपचय भवति अधिकं मन्येभ्यो मासेभ्यः. This is as mentioned by Charaka Samhita. According to Sushruta, षष्ठे बुद्धिः. Coming to the modern view, baby's immune system is developing and beginning to create its own antibodies. Lungs are beginning to develop and alveoli are forming. Skin is wrinkled and red. At this stage, the baby is 21 centimeter long and its weight is about 630 grams. Next, coming to 7th month. Saptame Sarvanga Pratyanga Vibhaga Pravyakta Tara. According to Sushruta, coming to modern view, baby may be very active now and others may be able to see its movement. Fat layers are forming, eyes partially open, eyelashes are present, thin skin is red and covered with vernix caseosa. The baby at this stage is 25 centimeter long. Its weight is about 1.1 kgs. Next, coming to 8th month. ओजो अष्टमे संचरति माता पुत्रो मुहुक्रमात् तेन तौ म्लानं मुदितौ तत्र जातौ न जीवति. Coming to the modern view, the overall growth of baby is rapid. Tremendous brain growth occurs at this time. Most body organs are now developed except for the lungs. Movements or kicks are strong enough to be visible from the outside. Skin is less wrinkled. Baby is about 28 centimeter long and its weight is about 1.8 kgs. Coming to the 9th month, after 9th month, it is the time for Prasava Kala. According to the modern view, at the end of 9th month, the baby is now fully developed and can survive outside the mother's body. The lungs are mature, skin is pink and smooth. Testes in the scrotum are palpable in the inguinal canal. Fingernail reaches beyond the fingertips. The baby at this stage is 32 to 36 centimeter long. Weight is about 2.5 to 3.4 kgs. The baby settles down lower in the abdomen to prepare for birth and may seem less active. Coming to the conclusion, hence in 9 months review of both Ayurvedic and modern science, we can see that except few things, whole description of fetal growth, that is MASANUMASIKA GARBHA VRIDDHI and development are similar in both the sciences. Thank you.
Thank you, Doctor.
Thank you.
So next I invite Dr. Arati for the paper presentation.
Yes, ma'am. Am I audible, ma'am?
Yes, Doctor.
Ma'am, slides are visible?
No, Doctor.
Yeah.
Doctor, please share the screen and start.
Yes, ma'am. Actually, I can't able to share it, ma'am.
Okay, Doctor. So you can present next. Please be there.
Okay, ma'am.
So next I invite Dr. Sujata Uttam Patole for the paper presentation. I invite Dr. Sujata.
Hello,
Hello, Doctor.
I'm sharing.
Dr. Sujata, please start.
Yes. My slides are visible.
No, doctor, it's not visible. Doctor, if there is any problem, you can press on next.
Okay.
So now I invite Dr. Arati. Dr. Arati,
Yes, ma'am.
we will share for you. Dr. Sabin.
Yes, doctor. 1 minute. Hello, Dr. Arati. The screen is visible, doctor.
Yes, sir.
Please start the session, doctor.
Good evening, everybody. Today topic is role of the RASOUSHADHIES used in the management of the APASMARA. Myself, Dr. Arati, second year PG scholar, Department of the PG Studies in the Rasaushadhya and Bhashaja Kalpana. Next, sir. Contents are the introduction, concept of the RASOUSHADHIES, bird view about the disease, that is APASMARA, Shamanaushadhi in APASMARA, probable mode of action of the RASOUSHADHIES, and discussion, conclusion, references, related articles, and the take-home message. Introduction. APASMARA is characterized by the loss of consciousness and the involuntary movements of the limbs caused by the dearrangement of the intellect and the mind. APASMARA is correlated with the epilepsy in the modern science. Epilepsy, it is a CNS disorder in which nerve cells activity in brain becomes disturbed, causing the seizure. It is a chronic neurological disorder characterized by the episodic unprovoked seizures. Around the 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. According to WHO 2019, patient with APASMARA undergoes a lot of distress, agony, and grief, leading to lack of performance at the personal as well as the social level. That is, the Ayurvedic treatment for the APASMARA has been divided into the Shodhana, Shamana, based upon the severity of the dosha as well as the bala of the patient. The protocol includes concept of the rasaushadhi. Alpamatropayogyatvat arucher prasangatah kshipramarogyadayitvat aushadabhyo adhiko rasa. The assimilation of the rasa preparation in the body is much faster because of the preparation undergoes different processes called as sanskaras. This helps in the active and the quick assimilation of even at minute dosage in the body, and it helps in the regaining the strength easily. Rasaushadhis in the form of the Basma, Paradiya, Murchana Kalpas, and in Vatti Kalpas are mainly used in the treatment of the APASMARA. Minerals, metals, and non-metallic substances are subjected to incineration and reduced to Basma form, where the particle size reduced significantly to a nanoparticle size. This facilitates the absorption and the assimilation of the drug into the body. The bird view of the epilepsy, that is APASMARA. Apashabdo gamanarthaha smaraha smaranam apagataha smaro yasmin rogo apasmara. According to the Sushruta, that is the Dallanatika. Smruto apagam prahur apasmara bisak videha tamaha pravesham vibhasta cheshtaha divas samplavat. That is according to the Charakacharya. And we can segregate the 3 phases of the Apasmara in such a way that Tamaha Pravesha, Vibhasta Cheshta, and these Sattva Sampravaha. And the management, these are the symptoms according to that phases. In Tama Pravesha, we can include the loss of consciousness or a deviation of the eyes, salivation of the spasm, and the sensation of the spasm, congestion of the heart, giddiness. In ictal phase, we can include the convulsion with a teeth biting, dribbling of the frothy saliva, expiratory dyspnea, involuntary speech or a murmuring, head retraction. In post-ictal phases, we can include the utter state of the consciousness, drowsiness, confusion, nausea, and the headache. And treatment aspect, in a Charaka Chikisana, he has told the Tairutanam Dus Manaso Samprabodhanam, Tikshnarado Bishak Puryat, Karmadi Manabi, Vatikam Basti Buishtaim. And Rasaushadhis, these are the different textures. They have mentioned the Rasaushadhis, like some basmas and some Ayurvedic formulations like Ashtamurti Rasayana, Apasmarari Rasayana, Tapadi Loha, Shwasakutara Rasayan, Mukti Pishti, Malla Sindura. These are the basmas according to the Rasa, Guna, Virya, Vipaka, and Karma. How they will act in the Apasmara. Swarna Basma, we can consider here the Rasa is the Madhura, and Guna Snigtaha, Vira Shitaha, Vipaka it is Madhura. And it is having the karmas like a Metya Rasayana and the Vata Shamana mainly. Rajata Bhashma is the mainly main ingredient for the Rasaushadhis which are used in the management of the Apasmara. It is also having the karmas like Metya, Pramaharaha, Smruti Vardhanaha, Apasmarahara. Sir, next please. And these are the some Shamanaushadhis like Ekamulika Dravas, Churnas like Saraswata Churna, Kalyanaka Churna, what is like Shiva Gutika, Manasamitra Vatika, Grutas, Kalyanaka Grutaha, Tiktaka Grutaha, Panchagavya Grutaha, Mahakalyanaka Gruta. In Gogulu, they have mentioned the Saptamyushati, in Asavarishta, Ashwagandharishta, Saraswatarishta, and in Thaila, mainly for the Nasya purpose, they have told the Chandanadi Thaila, Jyotishmati Thaila, Brahmi Thaila, and Arkas, they have told the Rasvanadi Karka. Next, please. The mode of action of I have included some formulation like a Smruti Sagar Rasaha, Rasagandhaka Thalanam, Sashilaha Tamra Baspanam, Shuddhanam, Muchidanam, Church, Purna Bhavam, Rachashvatayi, Ekamamshatidaha Pajad, Brahmi Vara Tataivacha, Katapi Vija Thailena, Bhavayet Ekavaram. These are the ingredients they have mentioned in the Smruti Sagar. Mainly, they have used in the management of the Apasmara. The above said all the drugs are having the antioxidant property and which are good for the prevention of the nerve cell damages. And Parada, it is the having the Yoga Vahi property. Haratala, it is the mainly act on the anti-epileptic. And Manashila, it is the sedative hypotonic activity. Vacha, it considers the chemical composition that is Azoron. It is having the sedative effect and antidepressant and the anticonvulsant actions. And Smruti Sagar Rasa, it is significant relief in the cardinal symptoms ranging from the unconsciousness, falling down, these and articles already they have did the Limal experiment, that is the role of the Smruti Sagar Rasa. The next one is the Vata Kulantaka Rasaha, and this is the having the Parada, Gandhaka, Manashila, Kasturi, Nagakeshara, Jatipala, and the Lavanga and Dela. And Rasayana, these Rasayana Kalpa, it will helpful in the Mastishka and the Vatanadi. Kasturi, it is having the Kapha Pittagna and directly indicated in the Apasmara. Nagakeshara, it is the Mastishka, Balya, Nagakeshara constitute the Visa Chantam, A, B, and the Xanthus and exhibited in the anti-convulsant and the sedative effect. Chatifala, it is the Vedana Sataka, Akshepaharaha, Vata Shamaka. The Ela, it is having the major compounds, that is the essential oil, helps in the significant in the anti-convulsant activity. And the Lavanga, it is the significant used in the anti-epileptic activity. That is mainly used in the Vega Kalina Chikitsa in the Apasmara. These are the related articles and the references. Discussion, it is the Apasmara, it is the psychosomatic disorder, and it is the transient appearance of the unconscious associated with the latosome activities like frothing and the abnormal posture of the body due to the preservation of memory and the intellect and the other psychic factors. The treatment is aimed at a restoration of the three dosha balance is coupled with the correlation of the manasa dosa. Shodhana procedure is mainly applied in the management of the apasmara. In apasmara dosha being located in the important vital point, it is difficult to be treated. Hence, it should be treated with the rasayana therapies. These all our drugs are having the tikta rasa is said to be possess the medya property, and most of the drug mentioned these are having the tikta rasa only. Ushnavira of these drugs is also helpful in the elevate the vata doshas. And Medya Rasayana drug like Shankapushpa are rich source of the antioxidant and very good for the like prevention of the nerve cell damages. And conclusion, recent research studies shown the like significant anti-epileptic activity of RASOUSHADHIES and basmas like Rajata Sindura, Rajata Basma, Kaushi Asma Basma and the Smriti Sagar Rasa Itishi. And take home message, सर्व शास्त्र तत्वज्ञो न जानाति रसम यदाः सर्वतस्य उपासाय धर्महीनो यथा बुधः. And the अल्पमात्रोपयोगित्वात् अरुचेर प्रसंगतः क्षिप्र आरोग्यदायित्वात् औषधेभ्यो अधिको रसः. साधेषु भेषजं सर्वमिरितं तत्त्ववेदिनः असाधेषु अपि दातव्यो रसो अतः श्रेष्ठ उच्यते. Because of these all supernatural qualities of the rasaushadhi, we can able to cure or reduce the frequency of the epilepsy attacks, and even if they are told as the asadhi. Thank you everyone.
Thank you, doctor. So next I invite Dr. Mayuri Pramod Rao. I invite Dr. Mayuri for the presentation.
Yeah. Hello.
You are audible, doctor. Please share the screen.
Okay. Slide is visible.
No, doctor, it's not visible.
Hello.
Yes, doctor. Doctor, please share the screen.
Yeah.
Hello, Dr. Mayuri. You have any problem with screen sharing?
Yeah, it is not. I'm not
Don't worry,
able to
doctor.
share it.
I will share for you, doctor. 1 minute.
Okay.
Doctor, is the screen is visible, doctor?
Yeah.
Please
Thank you
start
so
the
much.
session, doctor.
Good evening, all of you. My topic of presentation is AMVAT, that is rheumatoid arthritis. Myself, Dr. Mayuri Avarkar, MD scholar, Rachna Sharir Department from Sri Ayurveda College, Nagpur. Next. Introduction. AMVAT is a condition explained in Laghutrayis, but not in Brihatrayis. First explained in Madhav Nidan by Madhav Kara, who lived between 600 to 700 AD, that is 1 century after Vagbhat. Later, books like Yoga Ratnakar, Bhaishajya Ratnavali, etc. quoted the shlokas of Madhav Nidan to explain the disease AMVAT without much change. Correlation with modern disease. Most of the Ayurvedic scholars correlate AMVAT with rheumatism, especially rheumatoid arthritis. Some scholars correlate it with fibromyalgia. Next, please. Nidan and Samprapti. Viruddha ahara cheshtasya mandagnira nishchalasya cha strigdam bhuktavato dhanam vyayamam kurvatasatha. Vayuna prerito hi amaha shleshma sthanam pradhavati tena atyartham vidagdho asau dhamanihi pratipadyate. Etiology and pathophysiology. First is Viruddha, that means unwholesome foods or combination of foods which affects adversely. Poor digestion power, defective metabolism, sedentary lifestyle, and also too much exercise. So affected defective metabolism with the influence of Vat also affects the normal functioning, and the products of this reaches dhamanis, that is blood vessels, and circulates all over the body, especially to the sites of kapha, and produces symptoms. This is the etiology and pathophysiology. Vata pitta kaphair bhuyo dushitah so agnajo rasaha स्रोतस्याम अभिषन्देति नानावर्ण अति पिच्छिलः जनयत्याशु दौर्बल्यं गौरवं हृदयस्य च व्याधीनामाश्रयो योष आमसज्ञोऽति दारुणम्. Next, this will show you the samprapti of Amvat, that is Ahar, Vihar and Manasik. All factors are included in it that leads to Agni Mandya, and further Amvisha, Samvat, Shleshmasthana, Dhamani and Dushti by Tridosh. All it leads to Amvat. Signs. The defective metabolic products with the influence of VAR produces symptoms in neck, lower back, and all over the body, and produces stiffness. Samanya Lakshan: Angamarda, Aruchi, Trushna, Alasya, Gaurava, Jvara, Apakah, Shunata, Anganam, Amavatasya Lakshanam. That is body ache, poor appetite, feeling thirsty, lethargic, heaviness in the body, feverish feeling, non-inflammatory and non-supportive nature. Ati Praribdha Lakshan: Sakashtah sarva roganam yada prakupito bhavet hastapada shiro gulfa trika janu sandhishu karoti sarujam shotham yatra dosha prapaddate sadesho rujjate atyartham vyadhi viruddha eva vrishchikaihi. Very difficult to tolerate when becomes severe, can also be considered as difficult to treat when aggravates. Severe pain in hand, foot, head, ankle, neck, low back, knee and hip joints. Pain and swelling is seen in different parts of body. Pain will be severe as if bitten by scorpion. That is the burning sensation. Upadrav. Next. These are the complications: anorexia and feeling of heaviness over the body, loss of interest, bad taste in the mouth, polyuria and burning micturition, hardness in the abdomen, colicky pain, reversal of normal sleeping habit, thirst, vomiting, giddiness, fainting, pericardial discomfort, constipation, stiffness, gurgling, intestinal sounds, and other complications. Doshik involvement and sadhasadhyata. Pittasya daha ragam sashulam pavanagam stitamitam gurukarang puramcha kafadushtam tamadishat. According to dosh involvement, they have given pitta is daha and raga, vata dosh shula due to kapha, stimitya pandu and tama. Prognosis is sadhyata eka doshaj is sadhya, yapya two doshaj when involved it is yapya, and all dosh when they are involved it is asadhya. Line of management: apatarpan, that includes langhan, pachan and doshavasechan, and svedan, ruksha sveda, snigdha sveda, upanaha sveda, rasayan chikitsa and pathya ahar vihar. This is the samanya chikitsa: langhanam, svedanam, tiktam, deepanani katunicha, virechanam, snehapanam, basti ascha marute, saindhavam anvasasya, kshara basti prashasyate. Yogaratnakar suggests sneha vivarjan. This is the Bhaishajya Ratanavali suggests the use of Saindhavadi and Brihata Saindhavadi Taila for local sneha. These are the references from it. Next. These are the Pathya: Ahar, Vastuka Saka, Sunthi, Ajwayan, Saindhav, Lasun, सहिजन, करेला, कुद्रम, कुलत्थ, उष्णोदक, अरिष्ट, अद्रक, मरीच, हिंगू, जीरक, परवार, यव, तक्र, गोमूत्र, एरंड तैल. And Vihar, Rukshayan, Langhan, Mrudu Vyayam, Svedan, then Chankraman and Ushna Bastan. Apatya. Curd, fish, jaggery, milk, viruddhahar, purvi vayu sevan, vega dharan, ratri jagran, bathing with cold water and ati bahaya. Medicines mentioned in Bhaishya Ratnavali, some lep, vat and churna are given. Next. These are all different formulations they have given. Ajmodadi Modak. Then in Gugur, Singhanath Gugur is the most commonly used medicine. Rasa Yoga, Hinguleshwar Ras, Amrita Manjiri Ras, Amvatari Ras. Management of Amvat, diagnosis of Amvat by history taking and investigation. In this, we include the rheumatoid factor, then the CRP value, and the ESR. Management, Langhan Pachan by Ampachan medicines like Mushtundak Vati, then Agnitundi Vati, Doshavasechan by Virachan with Eranda Taylor taken orally with warm milk, Svedan, Baluka Svedan, Rasayan Chikitsa, Vatahar Chikitsa, Ashwagandha compound, then Maharasnadi Kadha, Amvatari Ras, symptomatic treatment if necessary, Pathya recommendations. The clinical studies based on Amvat with Singhanath Gugur and Shatapushpadi Lep. It was published in 2014. Next. This is another case study. Next. Then according to modern, if you want to study rheumatoid arthritis, commonest inflammatory joint disease in clinical practice affecting approx 1% of population, chronic multisystem disease of unknown cause, characterized by persistent inflammatory synovitis leading to cartilage damage, bone erosions, joint deformity, and disability. Etiology, autoimmune multisystem disorder. Although rheumatoid arthritis may present at any age, but incidence is more common in 3rd to 5th decade. Then smoking it acts as the aggravating factor for it. Early menarche also increases the risk. And in female, it is more common than in male. Then relative incidence of joint involvement, the metacarpals and joints of feet, metatarsals, 90%, knees, ankles, and wrist, 80%, shoulders, 60%, elbows, 50%, and clavicular and subclavicular joints, 30%. This is the pathogenesis of rheumatoid arthritis. Some slides showing the swellings on the joints. This is the Z deformity of thumb. Ulnar deviation, multicarpal swelling, left wrist swelling. Here we can see the rheumatoid nodule. Then extra articular features, constitutional symptoms, most common fatigue, weight loss, anorexia, rheumatoid nodules, hematological thrombocytosis, normocytic, normochromic anemia, then Kaplan syndrome. Rheumatoid nodules. Then every system is involved in it. So respiratory, pleuritis, pleural effusion, pneumonitis. Then cardiovascular system includes asymptomatic pericarditis. Then cardiomyopathy, mitral regurgitation, rheumatoid vasculitis. Central nervous system include the peripheral neuropathy, cord compression. Eye includes the keratoconjunctivitis, episcleritis, and scleritis. It's a non-articular manifestation. Then the diagnosis is the American criteria of rheumatoid arthritis that was introduced in 1987. That includes the morning stiffness, arthritis of joints observed by physician of more than 3 joints, arthritis of hand joints, symmetric arthritis, rheumatoid nodules, positive rheumatic factor, rheumatoid factor, radiographic erosions. So if this criteria shows that if the score is 1 to 4, that must be present for more than 6 weeks, then it meets the diagnosis of rheumatoid arthritis. This is the classification criteria. Acute phase reactants. Laboratory investigations include CBC, acute phase reactants like ESR and CRP, rheumatoid factor, and anti-CCP antibodies. Rheumatoid factor. Other investigations. Then radiographic, we can see it in X-rays and the ultrasound defects, early soft tissue lesions it shows. MRI has greater sensitivity to detect synovitis and the narrow changes. These are some X-rays images. Then management, goals of management. Main focus is on relieving pain, preventing damage, patient education about disease, and aggressive treatment. Early aggressive treatment is very essential. Treatment, it includes NSAID, steroids, TMRDS, biological therapies, and surgery. This is some modern treatment for it. Corticosteroids that are given in rheumatoid arthritis. Its limitations. Surgical approaches are there. Then, thank you.
Thank you, doctor. So
Thank you
next
so
I
much.
invite Dr. Sujata Uttam Patole. I invite Dr. Sujata Uttam Patole.
Yes, I'm sharing. Is it visible?
No, doctor.
Is it visible now?
No, doctor. Dr. Sadhvin,
Sorry, I'm unable to share.
Dr.
Dr.
Sujata, I
please
will
be
share
there.
for you. Dr. Can you hear me? Can you hear the slides?
Yes, yes.
Please start the
Good,
session, doctor.
okay. Good evening, everyone. Myself, Dr. Sujata Uttam Patole, PG final year from YMT Ayurveda Medical College, Kharghar. The title of dissertation is an assessment of the effectiveness of Nirgundhedi Dhupa Yoga in comparison with standard protocol of dressing in management of Dushavran, a comparative clinical trial. Aim to study the effectiveness of the Pranadhupan of Nirgundhedi Dhupa Yoga in comparison with standard protocol of dressing in management of Dushavran. Objectives. Primary objective was to assess the effectiveness of Ranadhupan of Nirgundadi Dhupa Yoga in management of Dushavrana. Study the various aspects of Dushavrana. Secondary objectives: to review the effectiveness of standard protocol of dressing in management of Dushavran. Study the concept of Prana Shodhana. Study the preparation of Nirgundadi Dhupa Yoga. Materials used: dressing material and solutions, transparent graph paper, modified Dhupa Yantra, contents of Nirgundadi Dhupa Yoga. Next, these are the contents of Nirgundadi Dhupa Yoga. Nirgundi, Nimba, Devadaru, Sarshap, Shuddha Harta, Gogrut, Sharkara, Madhu. Reference was taken from Harit Saita, Sthana 3rd, Adhyay 11. Nirgundedala Nimbapatra Haritala Sarshapa Churnakam, Devavruta Sharkara Madhyutam, Dhupam Bhagadarge, Durname Sa Ruje Vranicha, Vishame Dushte Visarpe Shuja, Pama Penasa Kasa Nashana Karo, Dhupo Grav Chedanam. Methodology: study setting, the patient diagnosed with a Dushtavrana selected from the OPD and IPD of Shalatantra department of concerned institute. Preparation of Nirgundadi Dhupa Yoga. Churna of Nirgundi Patra, Nimba Patra, Hartal, Sarshap, Devadaru, Sharkara taken in equal amount, mixed with the Ghruta and Madhu, and the Vranadhupan done on Dushtavrana. Study population sample size was 72. In each group, 36 patients. Group A was trial group. 36 patients treated with the Vranadhupan of Nirgundadi Dhupa Yoga after cleaning of wound with the sterile water. And group B was control group. 36 patients treated with only standard protocol of dressing, that is debridement, NS wash, betadine, H2O2, etc. Dhupan procedure. The Vranadhupan of Nirgundadi Dhupa Yoga done to the wound by exposing the wound to the smoke coming out from the specially designed Dhupan Yantra. Fumes are exposed to the wound for 15 minutes after cleaning of wound with the sterile water. This procedure was done for 10 days and assessment was done on 0, 7, 14th and 21st day. Method of selection of subject. Inclusion criteria was age above 18 years, all patients with Dushtavan, patients selected irrespective of sex, occupation, education and habit. Exclusion criteria was specific ulcers like lepromatous ulcer, malignant ulcer, uncontrolled DM, seropositive patients, varicose ulcers, tubercular ulcers. Withdrawal criteria was the patient not complying with the treatment protocol, any critical emergency, if any side effect occur, the patient not on regular follow-up. Criteria for assessment, subjective parameters was Schuler, Strava. Next. Objective parameters was the Gandha, granulation and the size of wound. Treatment detail and schedule. The screening and selection of patient carried out as per inclusion-exclusion criteria included for the study. Then written informed consent was taken. According to the randomization chart, patient included in the study in group A or group B. The daily follow-up of the tracing and the management assessment will be done on 1st, 7th, 14th and 21st day. Completion after 21 days, statistical analysis and the interpretation of the result. Statistical analysis. Parametric test, intergroup comparison was done by using t-test. The non-parametric test intergroup comparison was done by using Mann-Whitney U test. Next. These are the descriptive statistical analysis and comparison between two groups. Intergroup comparison of pain. Next. Intergroup comparison of discharge. Next. This is the intergroup comparison of size of wound. Observation. There was statistically highly significant difference seen in the values between the groups for pain, discharge, granulation, and the size of wound. Next. Discussion. Effect of therapy. In this clinical study, it is seen that the clinical parameters like pain, discharge, foul smell, granulation tissue, and the reduction of size of wound were significantly reduced after the treatment in trial group than in control group. Probable mode of action. Of significant result was obtained when the wound is subjected to the Dhupan. Fumigation of wound of the Dhupan itself. Also, these are the probable mode of actions. Next. Conclusion. The Nirgundyati Dhrupa Yoga Vrana Dhupana is effective in the Dushtavrana. There is a significant difference in the score of the parameters of Shula, Strava, Vrana Gandha before and after the treatment by Nirgundyati Vrana Dhupan than the standard protocol of tracing. The results found in the Nirgundyati Dhrupa Vrana Dhupana are encouraging and it can be used in the routine management of Dushtavrana. These are the before and after photographs of Radhadupan of wound. For the scope of study, the infected wounds are caused due to the various aspects. Detailed study of the compound on each of these aspects can be done. The various types of bacteria are involved in the formation of infected wounds. The detailed study of the efficacy of Nirgundyati Dhupa Vranadhupana on each of the stains can be carried out. Thank you.
Thank you, doctor. So next I invite Dr. Nitin Boban. I invite Dr. Yes, doctor, you are audible.
Okay. Is the screen visible? Hello?
Yeah, your screen is visible.
Okay.
It's visible, doctor.
Okay, let me start. Okay. Hello? Shall I start?
Yes, doctor, please.
Good evening, all. Myself, Dr. Nitin Boban from Ahmedabad School of Ayurveda, presenting the topic Public Health Approach of Ayurveda and Yoga and Long COVID. Together by Dr. Delvin Robin, Dr. Vandana Rani, Dr. Anushree Dileep, and Dr. Meera S. Coming to the introduction, the COVID-19 pandemic has unprecedented several aspects and challenged the healthcare system. The long COVID was listed for the first time in 2020 in the context of further long COVID-19 symptoms. In recent months, our knowledge on long COVID has expanded mainly to recognition of new clinical manifestations, and the long-term consequences remain unknown. Coming to the public health approach of Ayurveda. So the long COVID is defined as the signs and symptoms that are bring on infection with COVID-19 run for more than 12 weeks and do not explain the alternative diagnosis. So according to Sujata, the basic aim of Ayurveda is sustainable source and others to vigatration. The concept like Dinacharya, Ridhucharya, Ratacharya can be called as public health approach to personal health of the community. So yoga, which aligns the body, mind, and spirit, enhances mental clarity and strengthens the motor function. So the present presentation mainly focuses on the public and post-COVID problems like fatigue, sleep and mental disorder, alternation, dysfunction, dyspnea, and joint pain. Coming to the first problem, that is fatigue. Prevalence is more than 70%, and the risk factor is dysregulated immune system and psychological distress during acute and subacute phase of infection. Coming to the major public health approaches in management, first is cognitive behavioral therapy, performed in Netherlands in the online program. This duration is 1 4 months. Relaxation techniques, including pacing techniques, and as per the Department of Nutrition Dietetics, they mainly followed a post-COVID diet, which mainly include the food which is lowering salt and sugars, eating less of bread and processed meat, etc. Coming to the interventions during in Ayurveda and Yoga, as per our recommendation, Rasana therapy, mainly Ashar the Rasana is mainly given. And suggestions for implementation include general awareness about the introduction Pradimashtan Asya program. That is, as per classic, you can see the Pradimashtan So that can be implemented. Community awareness program regarding the importance of pranayama can be done. And isometric yoga program, which is practiced in various, it shows result in post-COVID fatigue. As per studies, this can be also applied in post-COVID fatigue. So it's a 20-minute yoga programs and fixed poses that can be seen from this figure. Next problem is sleep and mental disorder. It's also the main problem in the post-COVID patients, and risk factors include social stigma caused by the infection. And the major public health interventions include cognitive behavioral programs, relaxation techniques, which include cognitive intervention, social strategy, and behavioral health programs. And the major interventions during Ayurveda include pranayama sections in Ayurveda clinics, that is post-COVID clinics in Kerala, Yoga Nidra sections, Asana therapy, Nilishana Champasha, Pinachere procedure. And studies show that Pradimotion phase increasing the Satyana and Gadana also helps in reducing the clump of patients, and Vimran association therapy is effect on headache and anxiety problems. So that can be implemented. And suggestions for implementation include awareness about the procedures, and start counseling sections, promote Sadhuta principles to higher extra clinics and social media platforms. Coming to the next problem, there is olfactory and respiratory dysfunction. As per studies, it causes more than 6 months or more. So this factor includes those with smoke, allergic patients, especially those who have respiratory allergy. So the major public health interventions include counseling and psychosocial support, olfactory and respiratory program, and olfactory rehabilitation, including nasal rinse, etc. Coming to the major public health interventions from include Nasya regimen, yoga interventions include Jalanity and black fish techniques. So this is mainly practiced. And further suggestions for implementation include awareness program on oral and nasal hygiene, importance of Kamana, Gandu, program, and oral and nasal examination camp, the specialized medical officer. So that can be implemented. Coming to the next program, dyspnea, there is 30 to 40% of people with confirmed case of COVID-19 experience shortness of breath. So the risk factors mainly in post-COVID patients who are admitted in ICU, acute stress or anxiety following the disease, and those who are having asthma. So the major public health interventions include deep breathing exercises, so 6-week rehabilitation program, and awareness programs on patient cognitive breathlessness. That mainly include high side lying, forward in sitting, not able to. So that can be seen from this figure. So the major public health interventions from Ayurveda and yoga, which mainly include yogasana practices, standing, sitting, guidelines, pranayama sections. Then, as per studies, we can see that pranayama has increased in respiratory flow rate, post vital capacity. So that can be practiced. So also Kapalabhati can be done. We can practice of Kapalabhati helps enhancing the post vital capacity. So that can be also practiced. So further suggestions include implementation rehabilitation for Ayurveda for post-COVID dyspnea, telemedicine program, awareness campaigns about diet that need to be followed, and regular follow-up for patient assessment of their comorbidities. So coming to the next problem, joint pain. So it usually starts 2 to 3 weeks after declaring. The major risk factors include the autoimmune attack on joints, and the major public health interventions include muscle strengthening exercise like Tai Chi, and awareness on physical activities, strengthening exercise program that can be done. Next will be the major public health intervention that can be done. Asanas and breathing sections can be given. Am I audible? Hello? Am I audible? Hello?
Yes, doctor, you're audible.
Okay. Next,
Doctor,
asanas and breathing section.
can you please check your slides? Doctor?
Yeah, is it visible?
It's visible, doctor, but
Hello?
I think it's not moving. Can you please check? Doctor, I think your slides are not moving. Can you please check?
And now is in major public health intervention from SUSRUTHOKTA and yoga.
Yeah,
right?
it's now
We
visible.
can see that slide. Okay.
Yes, doctor.
Next, coming to the suggestion for implementation, that is introduction of rehabilitation centers and awareness campaigns about the diet and regimen that need to be followed. Coming to the challenges for public health in Ayurveda. So first is that we need more specialized dispensaries. It's like much needed, and need for more scientifically valid studies based on Ayurveda results. That is also very important nowadays, because we need a valid proof before going to the public. So that is also very important. And next is lack of adequate knowledge among Ayurvedic in public. There is next is lack of adequate infrastructure, and next is the reduced health seeking behavior in Ayush as compared to modern medicine. And the future perspective, which mainly include integrated approach, mainly need include the combination of government, non-government agencies very much essential, and programs and activities as well of the health authorities is very much essential. And need for more public health studies related to Ayurveda and yoga is also very much essential. And also we need a public health model for managing the problems in the community, and programs for creating awareness among modern practitioners about the strength of Ayurveda and yoga and public health. That also they are very much essential in the current scenario. So thank you. Hello.
Thank you, doctor. So next I invite Dr. Rasiga Ravindra Banso. I invite Dr. Rasiga. Dr. Rasiga, please unmute. Dr. Rasiga, please unmute yourself. So next I invite Dr. Markat Vaibhavi Lakshman.
Hello, I am audible.
Yes, doctor.
Please share my screen PDF. Hello.
Yes, doctor. Please wait. Dr. Sabin.
Yes, doctor. 1 minute, doctor. Hello, doctor. Please start the session, doctor.
Good evening, everyone. Myself, Dr. Markat Vaibhavi Lakshman, Department of Kaya Chikitsa, second year PG scholar. My topic is COPD. COPD is chronic obstructive pulmonary disease. Definition: COPD, chronic obstructive pulmonary disease, is the disease of respiratory tract that produces an obstruction to airflow and ultimately can affect both the mechanical function of the lungs and gas exchange capability of the lungs. It is the preventable and treatable disease. Two distinct processes are involved: emphysema and chronic bronchitis, usually progressive and associated with inflammation of the lung as they respond to non-noxious particles or gases. Epidemiology of COPD: 30% of smokers develop COPD. 20% of adult male have COPD. 15% of COPD patients are severely symptomatic. Fourth leading cause of death in USA. Mortality rate still rising. Increased prevalence in low birth weight and low socio-economic status. Tuberculosis in smokers predisposes to COPD. Two major causes of COPD. First one is chronic bronchitis and second one is emphysema. First, chronic bronchitis is a chronic inflammation of and gas and excess mucus production. Presence of chronic productive cough. Emphysema: damage to small sac-like units of the lungs that delivers oxygen into the lungs and remove the carbon dioxide. Chronic cough. Primary symptoms: chronic bronchitis, chronic cough, often called smoker's cough, coughing of mucus, shortness of breath, wheezing, chest discomfort, and frequent cleaning of throats. Emphysema: frequent coughing or wheezing, a cough that produces a lot of mucus, shortness of breath, especially with physical activity, and tightness of chest. What can cause COPD? Smoking is the primary risk factor. Long-term smoking is responsible for 80 to 90% of cases. Smoker compared to non-smokers is 10 times more likely to die of COPD. Prolonged exposure to harmful particles and gases from second-hand smoke, chemical gases, and dust from grain, minerals, and other materials. Genetic factors. Alpha 1. Diagnosis, spirometry, lung function test, X-ray, CT scan, and ABG. Risk factor for COPD, smoking, cigarette, and secondary smoke. History of childhood respiratory infections, genetic makeup, and increasing age. Treatment, eliminate exposure to things that cause COPD, avoid smoking, exercise, and pulmonary rehabilitations. Inhaled medications to open the breathing tubes or decrease the inflammations. Oxygen treatment, lung volume reduction therapy, physical activity training, transplantation, visit doctor regularly, medications, and improve quality of life. Medications, bronchodilator, short-acting beta-2 agonist, long-acting beta-2 agonist, methyl xanthicity. Anticholinergic and steroids. Mucolytics and mucokinetic agents. Antihistamines and oral and IV antibiotics. Thank you.
Thank you, doctor. So now I invite Dr. Madhav Maske for the presentation. I invite Dr. Madhav.
Am I audible?
Yes, doctor.
Hello.
Hello,
Am I
doctor.
audible?
Audible, doctor.
Good evening, everyone.
Doctor, you are audible.
Myself, Dr. Madhav Maske, PG scholar, Shalyatantra Department, GSU Usmanabad. Today's topic of presentation, a case study, efficacy of Matra Basti in back pain, that is Kati Sandhigat Vat. Introduction. Mostly 70% of Indian population is affected. Hello.
Yes, now it's visible.
Doctor, please continue, doctor. Please continue.
Mostly 70% of Indian population is affected by low back pain. Stress at workplace is the main causative factor. Low back pain can be referred as Katigraha, Trikagraha, Kativayu, Trikashul, Vatashul. There is a pain or shul in Kati region, which is the main symptom of low back pain. The ventilator Vatadosha vein lodged in the Katigat area causes asphyxia, that's osteoporosis, resulting in pain and difficulty in movement of Kati region. Basti Chikitsa is referred as the Ardha Chikitsa for the ventilator Vatadosha. Methodology. Patients was selected from outdoor patient department, Shalyatantra GSU Usmanabad. For Matra Basti, Tiratel for local oleation, Pinda Svedana for Svedan, and 60 ml Matra Basti with the Tiratel, Dhanvantar Tel, Sahacharadi Tel. Patient was given treatment for consecutive 15 days. Detailed history was taken before treatment. Procedure, Purvakarma. Patient was given prone position and local abhyanga with a tirtel was done. Then Pindasved was given locally. The patient was asked to consume light breakfast after some time. Pradhan Karma. Patient was given left lateral position. 65 cc syringe was filled by medicated oil. Oil was applied to the anal region and tip of catheter was inserted in anus. The piston was slowly pushed till the all oil get inside. Criteria for assessment: low back pain. At 0, no pain after sitting. 1, pain start after sitting for 30 minutes. 2, pain start after sitting for 15 minutes. 3, pain start immediately after sitting. Stiffness. At 0, no stiffness. 1, in morning only 5 minutes. 2, during daytime for 15 minutes. 3, during daytime for more than 15 minutes. SLRT, 0 at 90 degree, 1 60 degree, 2 at 30 degree, 3 at 0 degree. History of present illness. The 55-year-old patient has low back pain for last 1.5 years and came to Government Ayurveda Hospital, Usmanabad for treatment. Past history of STN. No any other major illness like DM, ISD, COX, bronchial asthma, etc. Surgical history. No any major surgical history. No any medical or drug allergy history. Personal history. Appetite normal. Diet mix. Sleep normal. Micturition normal 4 to 5 per day. Bowel normal 2 times per day. Addiction alcohol consumption since 32 years. Occupation service in bank. Family history not specific. General examination not specific. Systematic examination not specific. Examination. No tenderness at rest in low back area. No any swelling. SLRT test at 30 degree. CVS normal. CNS normal. RS normal. Blood pressure 130 by 80 mm of Ag. Pulse 82 per minute. Observation and result. Assessment. Low back pain at start 2, at 7 day 1, at 15 day 1. Stiffness at 7 day 1, at 15 day 1. SLRT at start 1, at 7 day 0, at 15 day 0. Patient got relief from our treatment of 15 days. Further advice to take oral medication. Discussion. Katigat Vata is not directly mentioned as a disorder in Ayurvedic test. Kati is the stan of Apan Vayu. In Kati Sandhigat Vata, Vata dosha is vitilated by its Ruksha and Shita Guna. This vitilated Guna can be best controlled by Basti Chikitsa. Acharya Agnivesha has stated the Basti in Ardha Chikitsa for Vata Vyadhis. For long-term treatment, Matra Basti is recommended, which is a type of Anuvasan Basti. The patient is geriatric, that is old age. He has sedentary lifestyle and there may be chances of wrong sitting style in the result of low back pain. Matra Basti is effective in this patient by decreasing Ruksha Guna of vitilated Vata dosha. Matra Basti help in breaking the Samprapti of Kati Sandhigat Vata due to its peculiar Snehan properties. Bibliography. Conclusion. Matra Basti shows significant effect on ventilated Vata in Sandhigat Vata. It is result oriented and cost effective. Thank you.
Thank you, doctor. Next, I would like to invite
So
Dr.
next
Resika
I
for the
invite
paper presentation. Next, I would like to invite Dr. Resika for the paper presentation. Dr. Resika, are you there? Dr. Resika Ravindra Bensud, are you there?
So
Dr.
next
Resika
I
Bensud, are
invite
you there?
Dr.
Hello. Hello.
Hello, doctor. Please share the
Hello.
screen,
Yeah,
doctor.
this is Dr. Rasika. Can you hear me all?
Yes, doctor. Please share the screen, doctor.
Very good evening, all the doctors, the respected jury members. This is Dr. Rasika Bansod. This is third year PG student from Shalakya Tantra SST Ayurved Mahavidyalaya, Sangamner. I'll be presenting on the topic efficacy of Yoshadivati in the management of Pratisha. Is my slides are visible, doctors? Is my slides visible?
Doctor.
Visible, doctor.
Yeah, thank you. Efficacy of Yoshadivati in the management of Pratisha. I would like to brief you all on the topic introduction. Common cold is the commonest and frequently troubling disease, and this study was mainly done in the period when the common cold was in the air. So common cold where more care and attention is needed because it affects and it can lead to the various different diseases, as per also told in our ancient literatures that it may also lead to Rajayakshma. So any patient presenting with the symptoms of Pratishay, it could be any symptoms like Shavatu, Nasastra, or it could be a blocked nose, or it could be a runny nose, or maybe it could be a epistaxis also. But that has to be taken seriously as Pratishay can lead to various upper respiratory disorders, lower respiratory tract disorders, and also Rajayakshma, and also we have also gone through the phases of COVID-19, first wave, second wave. So many people were quite worried about if they get the common cold. They used to get very much worried and panic about the disease, and they used to feel that no, I could have got COVID-19. So the symptom itself was taken for the study. So management of pratishay needs more care and observation, since the complications can lead to many conditions. Hence, some Ayurvedic preparations in Sanchaman therapy can be used in treating the disorder called pratishay, and the study was taken in our respected college OPD, that is SST Sangam, SST Ayurved Mahavidyalaya Sangamner OPD, and a few patients were selected, 15 each from the control group and one from the trial group. The control group was given Vyoshadi Vati, and the trial group was given CPM, that is chlorpheniramine maleate, which is the H1 receptor blocker, antihistaminic, and also it acts as anticholinergic drug. The actual treatment procedure for taken up as Ayurvedic line in pratishay includes Nehapan, Swedan, and Shodhan. And here what I used is Vyoshadi Vati. So it is a simple classic preparation used as Sanchaman therapy in the management of pratishay. The relief in pratishay, as per the mention, was selected to find out its efficacy in the management of pratishay. The overall effect of Vyoshadi Vati was much better in terms of reducing the symptoms and signs that as compared to the patients, that was given the chlorpheniramine maleate. The symptom of common cold resembles mostly the lakshanas, various lakshanas in as pratishay explained in Ayurvedic texts. The pratishay is one of the disease in which the inflammation of inner lining of the nose, that is the mucous membrane of the nose, is observed, and it is correct. The two symptoms were taken up for the studies was Nasastrav and Kshavatru. Nasavarod, Kshavatru, Shirashul, Swadavarod, Gandhanjan, etc. All the symptoms are described in the literature. Hello? Yes?
Doctor, your slide is not moving, doctor.
My slide is not visible?
Your slide is visible, but not moving, doctor.
Okay, it's not moving. Now?
No, doctor, not moving.
Just 1 sec, I will try.
Okay, doctor.
Slide like this. 1 sec, I'm trying to adjust.
Okay, doctor.
Slide nahi this.
Okay, doctor. Now moving,
Now?
doctor. Now moving, doctor. Moving, moving.
Thank you.
Okay.
Yeah, thank you. I'll take up. It's very contagious disease. The pratishay is very contagious disease seen all over the world. It's really causing much distress because it gives the disability of life in day-to-day life, which causes distress and comfort to people. The constant nasal discharge, sometimes the foul smell also comes. Sometimes in few patients you see the recurrence is also there in some atopic individuals, which having the tendency of getting the allergic conditions like asthma and eczema. In such patients, you see these symptoms coming again and again. So the life of the patient really becomes very difficult for them. The constant nasal discharge is also there. Pratishay is a simple disease. If we don't treat it, so it may lead to kas, shwas, even severe diseases like Rajayakshma. And nowadays, the new disease is being added. It's called COVID-19. It can be taken up as the prodromal symptom of COVID-19. So, giving more emphasis on treating the pratishay in the early phases, this study was taken up. And elaborative description of this disease and pratishay in terms of etiology, pathology, signs, and symptoms, as per the ancient texts, like in Charak Samhita, Sushruta Samhita, and Yogratnakar, and also some modern studies were done. The complication of Pratishay can also lead to some adverse conditions, and the treatment given described in our ancient literature includes Snehapan also, Svedana, Shodhana, but here the treatment chosen was given Sanchaman therapy with Vyoshadivati. Generally, the people desire to get relief in the minimum period, though the number of medicines available in the modern systems are very much, and there is still a scope for the study of Ayurvedic preparations and some kalpa using in this study, because the drugs used in modern medicines, they might have some side effects, as the drug chlorpheniramine maleate is widely used in common cold as antihistaminics, H1 blocker, also anticholinergic action, but it can also give you some dryness of mouth and the effect of drowsiness, which is really very dangerous, because sometimes patient has a common cold, he goes to the chemist shop, he asks the chemist to give some medicines for Pratishay, or you say common cold, and the chemist people, they give CPM, and patient doesn't know the side effects of the medicine. He takes it up, sometimes he drives, sometimes he goes for his all day-to-day life work, sometimes he doesn't know what could be the action of the drug, and due to the drowsiness, many accidents can happen in the life of patients, and here the need of the drug came up, that if a few side effects of the modern medicines that you get on OTC, that is over the counter, that you get to the patients, so there could be some medicines in Ayurvedic preparations which can be used as a safe drug with which is as effective as, or maybe more effective as, the chlorpheniramine maleate, and the drug was chosen. And as a result of such exploration, the present preliminary research was planned up, taking up using the drug Vyoshadivati in the symptom of Pratishay. Aims and objective: to evaluate the efficacy of Vyoshadivati in the management of Pratishay, and second was to compare the result of Vyoshadivati with the patients that were given chlorpheniramine maleate for the same symptom. So case history: 30 patients which came up in SST Ayurveda Sangamner College OPD with the symptom of Pratishay were taken up. 15 patients were given Vyoshadivati and 15 patients were given CPM as the drug. Vyoshadivati, which is described in Yogaratnakar Uttar Tantra, Nasaroga Chikitsa Adhyay. It has the composition of Shunthi, Maricha, Pippali, Chitrakmool, Talispatra, Amlika, Amlavetas, Jiraka, and Sukshma Ela, Swak, Tamalpatra, Chavya, and Puranaguda. All these drugs are mostly Katutikta Katu Ushna in Rasavirya Vipa. So doing the Kafagna activity or Kafahar activity, and thus causing the Kafa Vilayan of the Kafa, which is the dosha present in Pratishay. In Pratishay, then all doshas come to the Shrungatak Marma. It irritates that and causes the symptoms of Pratishay. In this the Vyoshadivati, having all these Kafagna dravyas, causes Kafa Vilayan, and hence giving the relief from Nasastrav and Kshavathu, which together we call as Pratishay. CPM, here CPM is the H1 blocker drug, which causes the action of antihistaminics and anticholinergic action. H1 and H1 blocker works on the H1 receptors in the body, which causes the release of mast cells, leukotrienes, some bradykinins, and anticholinergic action, where it reduces the secretions given in the body, like nasal secretion. So it reduces the pratishay in this mode. So type of study was taken up open randomized control clinical study. Method of study: the patients of either gender, both male and female, in the age group of 20 to 40 were selected, and there were 15 patients were given Vyoshadivati, 5 to 10 grams, that is two tablets twice a day for 7 days, and CPM was also given 4 mg orally, once in the morning, once in the evening, as per the intensity of the symptoms for 7 days, and then the follow-up was taken on 3rd and 7th day. Where Nasastrav in group A, that is Vyoshadivati, there was significant T value 6.08, and in group B, the patients who were given in the symptoms of Nasastrav, the T value came up with 4.58, which was also quite significant, but the results were slightly better with the medicines given with Vyoshadivati. Kshavathu, where in group A, 11.2 T value had come up, which is significant, quite significant. And in group B, where CPM was given, the T value came as 4. So there is a vast difference between the T values. It is also significant, but the Kshavathu, that is, was controlled in a better way with Vyoshadivati. In both the groups, the disease was found to be more prevalent in lower socioeconomic groups as compared to upper socioeconomic groups, as they were farmers, some were sweepers, and some were doing the activities with the cleaning, more or less. So the average analysis of the effect was of the drug in both the groups showed significant improvement on 7th day of the treatment as compared to the first day in all the symptoms, showing the higher rate of cure in both the groups. When the data was analyzed in pre and post treatment in both the groups, the positive values obtained was much higher in the symptoms of Nasastrav and Kshavathu on 3rd day, and on the 7th day it showed up the significant relief. On 3rd day, and the positive on the 3rd day, the symptoms of Nasastrav and Kshavathu was there, but it was not that high. So again, the patient came up on the 7th day for follow-up. At that point, when the patient was examined, it was seen that in Nasastrav also the results were good in the patient of Pratishay with Vyoshadivati, but the symptom of Kshavathu, there was very much good relief in the symptom of Kshavathu on the 7th day. The conclusion can be drawn up like the overall effect of Vyoshadivati is better in terms of reduction of symptoms and signs as compared to CPM, because there was no other side effect as drowsiness, which was quite higher with CPM, and the side effect of dryness of mouth, and in some patients, 1 or 2 patients were seen with dryness of eyes, like burning and continuous lacrimation, that is epiphora, was seen in 1 or 2 patients because of the dryness of the eye. So it can be concluded that with CPM, it also controls the symptoms in the patient But because of few side effects that it occurs, the disability of the patient in day-to-day life is consistently there, whether it is with the common cold or whether it is due to the side effect of the drug. The disability is there. Patient cannot go to the work or can't do the day-to-day life activities. So it was concluded that the overall effect of Vyoshadivati was better than CPM in controlling the Pratisha. Here are some references that were taken up from Chakrak Samhita, Charak Prapti, Charak Yoga Ratnakar, and Sushrut Samhita. Thank you all the jury members. This was my presentation on
Thank
efficacy
you,
of
doctor.
Yoshadivati. Thank you all.
Thank you, doctor. So before going to the next presentation, let me remind you, each one have maximum of 8 minutes for the presentation and kindly follow the time limit. Next, I invite Dr. Adnasi Shekhar for the presentation. I invite Dr. Aruna.
Hello.
Hello, doctor.
Doctor, you are audible.
Hello.
Your
Am I
screen.
audible?
Yes, doctor. Audible, doctor. Your screen is also visible, doctor. Please start the session.
Okay, thank you. Myself, Dr. Aruna Shekhar, second year PG scholar from the Department of Shalakya Tantra. And today I am presenting the topic Anushastra in Shalakya Tantra. Coming to the introduction, Shalakya Tantra, one among the 8 branches of Ayurveda, which includes the diseases of Uttamanga. And this Uddhajatru Pradesha gives shelter to the sensory organs. So, utmost care should be given to maintain health of Uddhajatru. And coming to the indications of Anushastras, Ashastra Avacharaniyeshu Shishu Prabhridishu Alabhatvat Shastranam is taken from Dalhana Susruta Sutra, 8th chapter. That means parasurgical procedures are utilized when contraindicated for surgery in infants, child, or very fearful people, in the availability of surgical instruments, and when the treatment is possible without surgical intervention. And Anushastra, Acharya Susruta have mentioned 14 Anushastras. They are Anushastrani tu Tvak Sara Spatika Kaja Kuruvinda Jaloga Agni Kshara Naka Goji Shephalika Shaka Patra Karira Bala Ankulya Iti. They are Tvaksara, bamboo bark, Spatika, Kaja, that is lead, Kuruvinda, Jaloka, Agni, Kshara, Naga, Goji, Shephalika, Shakapatra, Karira, Bala, that is hair, and Anguli, finger. And among these, the main 3 Anushastras are Agni, Kshara, and Jaloga. And Jaloga is Pratana among them. Agni is Pratana Tara and Kshara is Pratana Tama. And the functions of other Anushastras are like Nagha have Aharana, Chedana, and Vedana Karma. Gojihva have Lekana Karma. Shephalika and Shaka have Lekana Karma. Karira, this Ashana and Mukha, Netra and Vatma Rokas. Bala, this Sivana and Ashana, and Anguli is used for Ashana. Next, coming to Kshara Karma. Kshara is the Pratana Tama, and the Guna Karma of Kshara is Tritoshatna, Chedana, Bedana, Lekhana, Shodhana, Stambhana, Robana, Shoshana. And the types of Kshara based on the mode of administration are Paniya and Pratisaraniya Kshara based on the potency, Mritu, Madhyama, and Tikshna Kshara. And in Uddhajatru Vikaras, Mritu Pratisaraniya Kshara are usually used in the form of Ksharavarti or Kshara Sutra. These are the indications of Kshara in different Urdhvajatragata rogas. In Netra roga, Shara is indicated in Balasa Gradita, Lagana, Upapakshma Mala, Pakshma Koba, Shushkarsha, Arbuda, Visavarma, Alaji, Ubanaha, Pishtaka, Shira Shukla, and Savrana Shukla. And the common Shara used in these conditions are Langalik Shara, Yavak Shara with Vyoshadikrita, Vipitaka Shara, Gunjak Shara, etc. And in Karna rogas like Badhitya, Pudi Karna, Puyasrava, Karna Nada, Krimi Karna, Karna Arsha, and Karna Arbuda. Common Sharas used are Apamarga Kshara, and Kshara Taila is used. And then Nasa rogas like Pinasa, Kapacha Pratishaya, Nasa Arsha, Nasa Arbuda. Rituk Kshara like Apamarga Kshara, Chitraga Kshara, Kadali Kshara are used. And Shiro rogas like Indralupta, Dharunaga, Kapacha Shiro roga, Krimija Shiro roga, Palaksha Shara, etc. are used. And in Mukha rogas like Kapacha Ushtakoba, Jalarbuda, Adidanda, Danda Satkara, Danda Pupuda, etc. Yavakshara, Shara Taila, Apamarga Kshara, Swarjika Kshara, etc. are used commonly. Coming to the Agni Karma, synonyms of Agni Karma are Dahana Karma or Tapana Karma, cauterization technique which involves use of Agni in direct and indirect manner to cure health ailments is called Agni Karma, and it is mainly classified into 3 types based on Decide, Dhatu, Dahana. Shalaka, Pippali, Godhanda, Jirdha, Taila, and Ajashakrat are materials used for Agni Karma. And in disease context of Shalakya Tantra, Agni Karma is specifically mentioned in context of tissue destruction like Arsha, Arbuda, disease of Vartma for pain management purpose and to achieve hemostasis like in case of dental extraction. These are the Agni Karma indicated Urdhvajatragata rogas. They are Innetra roga, Mahalagana, Shushkarsha, Arbuda, Pakshma Koba, Arsha, Upapakshma Mala, etc. The hand with Shalaga and Tuji Yagra, Agni Karma is done. In Karna rogas like Karna Arsha and Karna Arbuda, Shalaka is used. In Nasa rogas, Nasa Arsha, Nasa Arbuda, Shalaka is used. In Shiro rogas like Vadacha Shirashula, Kapacha Shirashula, Arthava Betaka, and Suryavarta, Godhanda, Sarakanda, Achashakrat, Pippali, Kshaudra, Guda, Sneha, and Jambavosharyus. And in Mukha rogas like Medojashtakoba, Jalarbuda, Jalaganda, etc. Sneha, Kshaudra, Guda, Suji, Shalaga, and Madhujishta are used for Agni Karma. And in Mukha rogas, like in Medojashtakoba, Jalarbuda, and Dhanda Nadi, Agni Karma is done over the diseased tissue. And in Krishna Danda, Chala Danda, etc. Agni Karma is done after tooth extraction over the bleeding area. And next is mode of action of Agni Karma. The main function of Agni Karma is for Vedana Shamana, Rekta Stambhana, Dahana Karma, that is tissue destruction, and Apunarbhavatva, that is prevention of reoccurrence of the disease. And the mode of action goes like when the Agni is applied, the local temperature gets raised and the dilation of blood vessels occurs and leading to increased tissue perfusion, which in turn leads to clearance of accumulated metabolic waste in that area, and it resolves inflammation and thus reduces the pain. And Agni Karma is the base behind the recent advancement of and developments of cauterization, electric cautery, diathermy, radiation, and laser therapy. Next, going to Jaloga. Jaloga is the third foremost important Anushastra Karma and a method of Rakta Mokshana. Viravyadha mentioned in our Ayurvedic test is difficult to perform in Urdhvajatragata rogas. So Jaloga and Prachana are the easy and convenient methods of Rakta Mokshana. And Rakta Mokshana is of 2 types, Shastrakrita and Ashastrakrita. Ashastrakrita Rakta Mokshana done by using Stringa, Jaloga, Alabu, and Kadi. Jaloga can be classified into Savisha and Nirvisha. And Nirvisha type is indicated in Twakroga, Rektajaroga, Dushtavrana, etc. And Next, Jaloka indications in Chalakya Tantra diseases. In Netra Rogas like Anjana Namika, Savrana Shukla, Sira Shukla, Rektaja Abhishyanda, and Rektaja Dimanda, Akshiruja, Raga, Timira, etc. Jaloka is indicated. In Karna Rogas like Kaphanibanda Badhirya, Karna Vitradi, Karna Shobha, Pariboda, Uppada, Parilehi, Jaloka is indicated. In Nasa Rogas like Nasa Paka, Nasa Arbuda, Nasa Arsha, in Shirorogas like Kalitya, Palitya, and Indralukta, and in Mukharogas like Oshtaroga, Kandaroga, Shidada, Vaidarba, and Upakusha, Jaloka is indicated. Coming to the conclusion, according to disease condition, one can modify the Anushastra karma to provide maximum benefit to the patient, and Kshara karma, antiseptic and analgesic properties of Kshara cure the bleeding, discharge, and pain. Agni karma offers benefits in Vata Kapasha disorders, and Anushastra karma are minimal invasive procedures with greater efficacy even in the chronic illness. Thank you.
Thank you, doctor. So next I invite Dr. Shamjasi Shamsuddin. I invite Dr. Shamja. Doctor, just unmute yourself.
Hello. Hello, doctor.
It's
Am I
visible,
audible?
doctor.
Am I audible
Yes,
now?
doctor.
Good evening, everyone. I am Dr. Shamja, first year PG scholar, Department of Rasashastra Vaishyaja of Sri Jayanta Saraswati Ayurveda College and Hospital, Chennai. My topic is Masi Kalpana, a critical review on hair loss. Introduction. Masi Kalpana is an important dosage form of medicine in Ayurveda. It is prepared by heating herbal or animal content up to transfer into a carbonized form. In this method, bulk of raw material is reduced to a greater extent by combustion. Due to this, hidden chemical constituents become prominent and new chemical moiety is formed which is therapeutically active. Classical references of Masi Kalpana. The first classical reference we could get from Susruta Samhita, Chikisasthana, that is the Krishna Sarpa Masi, as well as the Hasti Danda Masi. We get the Krishna Sarpa Masi reference in Susruta Chikisasthana, 9th chapter, 17th shloka, and Hasti Danda Masi, Susruta Chikisasthana, 1st chapter, 101st shloka. Now, the types of masi based on the origin. We can classify into plants and animals. The example of plant origin is the Triphala masi, and that of animal is Hastidanta masi. Method of preparation of masi. Masi can be prepared by heating plant or animal content in a sharava with a specific temperature to its carbonized form. The smoke appears at the beginning of the process and the material starts blackening. Then the typical order of combustion is identified. Finally, when the whole material turns black and the smoke is completely removed, the Masi Kalpana is completed. Types based on the preparation. Depending on the hardness of the material, we can classify into two types, that is the Andarduma method as well as the Bahirduma method. The Andarduma method, the best example is the Hastidanda Masi. We get the reference from Susruta Chigisasthana, and the Bahirduma Masi, we get the reference from Rasendra Sarasangraha, Ubadamsha Chihilsa, and the example is Triphala Masi. Hastidanda Masi. Method of preparation. The coarse powder of Hastidanta is taken in a sharava and masi is prepared by covering with another sharava over it. Sandhibandhana is done with multani mitti and later 1 or 2 laguputta is given. When itself cool, the masi is taken out, triturated, and used with appropriate liquid media. Media of application as per different acharyas. Different acharyas opines the different applications. Medias. Acharya Sujata opines the Gomutra and Rasanjana as a media, whereas Acharya Bhavaprakasha opines Rasanjana and Gokshira. Gokshira by Yogaratnakara and Namnita by Harita and Kevala Hastidandamasi by Chakradatta. The indications of Hastidandamasi: Kalitya, Palitya, Indralupta, and Romashata. Significance of Hastidandamasi: Hastidandamasi krutva mutram cheva rasanjanam lomanyade jayante pani taleswapi. The term pani taleswapi in the verse indicates the growth of hair on the palm. However, the growth of hair over the palm is not possible as that area lacks of hair follicles. Therefore, this term is used to signify the potency of Hastidandamasi. Conclusion: few research works has been carried out in pharmaceutical aspects, but its therapeutic utility needs to be proved. Thank you.
Thank you, Doctor. So next I invite Dr. Manisha for the presentation. I invite Dr. Manisha.
Thank you, Doctor.
It's visible,
slide.
Doctor.
Okay, thank you. Myself, Dr. Manisha K, second year PG scholar, Department of Agada SDM College of Ayurveda and Hospital. My presentation is case presentation. Pradhana Vedana, complaining of pustular lesions over scalp, face, nape of neck, and elbow region associated with pain, burning sensation, and itching since 5 months. Vedana Vrittanta of patient. Patient was apparently healthy before 5 months. Later, he noticed itching sensation on scalp, followed by pustular eruptions with pain. Later, it developed over face, nape of neck, and both elbows. Pus were coming out and he feels severe burning sensation on lesions along with itching. He took some allopathic medicines and got little relief. For further management, he got admitted in STM hospital. Puravyadhi Vrittanta, it's nothing relevant. No history of diabetic mellitus, hypertension, thyroid dysfunction, no history of surgery. And Kula Vrittanta, nothing relevant. Vaiktika Vrittanta, appetite was medium, bowel regular, once a day. Micturition regular, 4 to 5 times a day, no burning micturition, sleep was sound. Personal history, diet mixed, non-veg, he will take non-veg food on weekly 5 to 6 times. Habits, nothing relevant. Occupation as a student, socioeconomic status lower class, treatment history, took allopathic medicine for the same. Dashavida Pariksha, Prakriti was Pitta Kapha, Vigruddhi Pitta Kapha, Sattva, Madhyama Sattvam, Satmyam, Kadurasa Pradhana, Sarvarasa Satmyam, Ahara Shakti, Madhyamam, Vyayama Shakti Madhyama, Sara, Rekta Sara, Samhanana Madhyama, Agni Shakti Madhyama, Vaya Yauvana. General examination was all normal. General complexion fair. BP was 120/80, pulse 73 per minute, respiratory rate 18 per minute, temperature he was afterable. Anga Pratyanga Pariksha, CVS S1 S2 heard, no murmurs, CNS conscious and oriented to time, place, and person. Respiratory system, normal vesicular blood sound were heard, no added sounds. Integumentary system examination. Location was scalp, face, bilateral elbow. Shape was elevated, color reddish, pus discharge was present, inflammation was present, pain was present, and on palpation, temperature negative, edema absent, texture of lesion was oily. Nidana Panchaga. Nidana, Adimamsahara Sevana, Adimatra Sevana, daily 6 times, like intermediate also he was taking food, and Divasapna soon after intake of food, especially after lunch, Shidambu Sevana and junk food. Purva Rupa was Kandu, Lakshana, Srava, Kandu, Paridaha, Ubashaya, nothing relevant was noticed. Samprapti Khadaga, Dosha, Pitta Kapham, Amam, Samam, Srotas, Rasa, Rekta, Mamsa, Srotas, Udbhavasthana, Amashaya, Dhadu, Rasa, Rekta, Mamsa, Agni, Jadarakni Mandyam, Sroto Dushti Pragaram, Sangam, Yimarga Gamanam, Adipravarti, Vektasthana, Urdhvagam. Differential diagnosis as Mukhadushika, Pama, Kachu, and Vispoda. It was not Mukhadushika because it was not restricted only on face, and it was not on Pama because feet and buttocks region were not affected. It also Kachu, the site of the lesions were not on the buttocks region, so it was not on Kachu. And then it was diagnosed as Vispoda, as that Tanutuk was there, and Sita and Aruna color of the lesions. And according to Dosha also Pitta Kapha was. So final diagnosis was Vispoda. These were the pics before treatment at the time of admission. Chikitsa Sutra, Vadottareshu Sarpirvamanam, Sleshmottareshu Kushteshu, Pittottareshu Moksho, Rektasya Virejanam Chagre, Shashte Mase Sira Moksham, Pratimasam Virejanam, Pratipaksham Chavamanam, Kushte, Lebam Trahya Ajari. First day treatment given was Sarvanga Abhyanga with Pabranadi Taila, followed by Parishega with Triphala Kashaya, Nimbadi Gugulu, Chitrakadi Vadi, Tulsi bathing powder for bath, diet, night kichadi. For itching and burn sensation, all this medication given, Chitrakadi Vadi for Amapajana. Next, second day, according to the acne of the patient, Snehapana was given with the Panchatikta Gugulukrita 30 ml. Advised to take sip by sip hot water, avoid exposure cold and day sleep, diet Ganji when he felt appetite, and external application of Tribala Churna with the warm water for the drying of the lesions and itching for reducing the itching. Day 3, Snehapana 40 ml according to his acne were given. Diet same, Ganji when hungry and night kichadi. Day 4, 70 ml were given, and day 5th, 100 ml were given. And Snehasnigdha Lakshanas obtained on the 5th day on his stool and the skin. Next day, Sarvanga Abhyanga with Yeshtimadu Taila, followed by Parishega with Triphala Kashaya were given. Diet were normal. Also advised the patient to eat whatever he want. As Vamana was planned for the patient according to his Sattubala also, and the lesions were made on the Urdhvaga. So Vamana were given to decide to given. So Purvakarma Abhyanga with Yeshtimadu Taila, followed by Bhashpasveda given. Pradhana Karma Vamana with Yeshtimadu Fanda given. We got 9 Vegas. Level of Shuddhi Pravara, Andigi was Pittandigam, Samyak Lakshana Skale Pravarti and Legutva. Discharge medicine were Tribala Gugulu, Gandhagara Sayana, Avipatikara Churna. And after treatment, these were the result. All the lesions were dried, and the itching, burn sensation were reduced to a marked extent. Up to 80% he got relief. Discussion initially to remove Amapajana, Deepana Pajana was done. Snehapana was planned with Panchatikta Gugulugrada, Tikta Drevya drug of choice in Tokvigaras, and it's also Pitta Shamaga. Vamana was planned for Dosha Shodhana based on Sattva, Bala of the patient Dosha involved in disease. Suitable Samshamana Aushadhi was planned for Shesha Dosha Nirharana. Conclusion, with Snehapana and Vamana, lesions dried and itching and burn sensation reduced up to a marked level. Thank you. Hello.
Next, I would like to invite Dr. Shari Praveen Bizan for the paper presentation. Dr. Shari, are you there? Hello, Dr. Shari Bizan, are you there?
Dr. Sarayu?
Dr. Shari Bizan, are you there? Okay, next I would like to invite Dr. Ravindra R. Tagore for the poster presentation. Dr. Ravindra R. Tagore, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes.
Your screen is visible, doctor. Please start the session.
1 minute, sir. Sir, I am presenting a poster here with topic critical analysis of cardioprotective role of Ayurvedokta Vriddhi vegetable. My name is Dr. Ravindra R. Thakur, MD Final Scholar, Institute, YAC and PGRTC, Kodoli, Kolhapur. My guide name is Professor Harshal Sabre, sir. Poster abstract. Death due to ischemic heart disease is increasing in Indian population at an alarming rate and accounts for around 15 to 20%, 25% of all the deaths in India. Dietary factors contributes largely in development of coronary artery disease, which manifest as a myocardial infarction. In Ayurveda, Acharya have described many vriddhya, that is beneficial to heart, or it may be a heart tonic vegetables. Ashtanga Sangra Sutrasthan Adhyay 6, Shlok number 156 and 160. Hence, it is essential to search for the cardioprotective role of Ayurvedic, the green leafy vegetable. Vegetables are classified into leafy and fruit. Acharya Sushruta in 46 Adhyay, Shlok number 221 to 48, the Kafanashaka vegetable and fruits. So Ayurveda I advocated for the diabetic by Acharya Sushrut have a low glycemic index for the modern point of view and are also have a protective value against the coronary artery disease. They are also said to be beneficial for heart. That's all called as Vriddhya. As per the Ayurveda, Vriddhya green leafy vegetables have tikta, bitter, rasatmak and kafanashak property, by virtue of which it lowers the elevated blood sugar and controls the calories and lipid levels. As per the modern findings, green leafy vegetables are rich in antioxidant, various vitamins, and produces very low calories. Green leafy vegetable results in decreased structure fatty acid percentage and increase in polyunsaturated fatty acid and omega-3 fatty acid percentage, thus lowering the hepatic atherogenic fatty acid. Vegetables rich in inorganic nitrates gets converted into nitrate and nitric oxide, producing vasodilatory and myocardial tissue protective action. Nitrates helps in lowering of blood pressure, improvement of endothelial functions, protection against the ischemic injury, and reduction in platelet aggregation. It is concluded that the use of Ayurvedic vegetable decreases the risk of coronary artery disease and have cardioprotective role. Introduction. The deaths due to ischemic heart disease is increasing in India. Population at an alarming rate and accounts for around 15 to 20% of all the deaths in India. The dietary factor contributes largely in development of coronary artery disease, which manifests as a myocardial infarction. In Ayurveda, Acharya have described many vriddhya, that is beneficial to heart. The vegetable Ashtanga Sangra Sutrasthan Adhyay number 6, 1 to 5 Shlok number and 160. Hence, it is essential to search for cardioprotective role of Ayurvedic, the green leafy vegetable. Materials and methods. Literary methods of research is used. Results and observation. Here, the leafy vegetable, that is Tandurja name in Marathi, and Amaranthus viridis. It is used in DM type 2, UTI, antioxidants, reduces weights and cholesterol, rich in vitamin A and K, B6 and potassium, protects bad cholesterol rapidly, and is cardioprotective. Brahmi booty, Centella asiatica, it is antioxidants, nervine tonics, helps in lowering blood pressure, has anti-cancer property. Sorry. Shri Dodaka, Lufa atalangulata, It has a significant glucose lowering activity and use as DM type 2 as anti-diabetic fruit, controls cholesterol, root extracts reduces ascitic fluid in ascites and anti-hyperlipidemic activity. Gojivha, Onosma bacteriatum. It is antioxidant useful in jaundice. It is cardiac. It is a cardiac muscle toner. It is rich source of potassium, minerals, calcium, and used in epileptic condition also. Useful in syphilis, leprosy, and kidney disease. Laghu Kauri, that is Solanum nigrum. It is used in severe hypertension, opium poisoning, hepatosplenomegaly, vitiligo, use in conjunctivitis, itching in eye, and is the best cardiac tonic. Padwal or Parval in Hindi and Trichoxanthus dioica, nematocidal and antihelminthic, anti-hyperglycemic, anti-lipidemic, used in diabetic management, cholesterol lowering activity. Chakwad, that is Sinopodium album. It is rich in vitamin A, B, C, iron, calcium, potassium, phosphorus. It is a cardiac protective and helps in lowering the cholesterol. Kurdu, Silosia agentia. It is used in several severe hypertension and anti-diabetics, anti-malarial, hepatoprotective, immune booster. Flowers and seeds are used in hematuria, occult blood in stool, that is Maliana. Next is Wangi, Solanum melongena. Indications: pneumonia, stomach ache, tonsillitis, wing worm, pain and inflammation, fever, tumor, hepatoprotective, diuretics, and antipyretics. Next is Methi, Trigonella phonumegri. It is used in diabetic DM type 2, anti-cholesterol agents, hyperlipidemia, immunity booster, reduces the risk of heart attack and high blood pressure. Gudwel, or that is also called as Guduchi, that is Tinospora cardifolia. Indications: fever, jaundice, chronic diarrhea, cancer, dysentery, bone fractures, pain, asthma, skin disease, poisonous insect bite, snake bite, eye disorder. It is also cardioprotective. Carle or Momordica charantia. It is very useful in diabetic management, good for skin and hair, improves cardiac health, weight management, and heals the wound. Palak, that is Spinacia oleracea. Indications: severe hypertension, CCF, anemia, brain nervine function accelerator, anticardiogenic, useful in weight loss, beta carotene and white rich source, antioxidant, eye tonic, having lutein and zeaxanthin, strong immunity booster. Changeri, oxalis corniculata, heart tonics, anti-cholesterol lipid lowering agent. Bhopala, that is Lagenaria ceraria, traditionally used in IIT of jaundice, diabetes, ulcer, piles, colitis, insanity, hypertension, CCF, cardiac disease, emetics, purgative. It helps boiling oil use in rheumatism. The Kaphanashak vegetables and the fruits so advocated for the diabetic, Acharya Sushruta, have a low glycemic index. As per the Ayurveda, Ruddhe green leafy vegetables have tikta, that is bitter, rasatmak, and Kaphanashaka property, by virtue of which it lowers the elevated blood sugar and controls the calories and lipid level. As per the modern findings, green leafy vegetables are rich in antioxidants, various vitamins, and produces very low calories. They also have ACE inhibitor action, producing vasodilatory effect. Nitrate containing vegetables helps in lowering of the blood pressure, improvement of endothelial function, protection against the ischemic injury, and reduction of platelet aggregation. Conclusion: it is concluded that the use of Ayurveda VRIDDHI, that is cardioprotective vegetables, have a cardioprotective role and decreases the risk of coronary artery disease. Thanks. It's over to you, sir.
Thank you, doctor.
Okay,
So
thank you.
next I invite Dr. Priyanka Dileep Chavan. I invite Dr. Priyanka Dileep Chavan.
हमको फोन ही नहीं है, मतलब फोन नहीं है।
Dr. Priyanka, are you there? So next I invite Dr. Sarayu Praveen Bisan.
Yes. Hello.
Hello, doctor.
Hello.
You're audible. Please share the screen.
Yes, sharing. Is it visible?
Yes, doctor. It's visible. Please start.
Okay. Hi. It's Dr. Sharayu Bisan, MD Scholar, PG Department of Rasashastra Bhaishajya Kalpana, Bhausaheb Ayurvedic Mahavidyalaya, Nandanvan, Nagpur. The title is Clinical Importance of Nadi Pariksha, Pulse Examination, and Ayurvedic Diagnostic Method. Introduction. Ayurveda gives emphasis on diagnosis of disease before starting treatment. Examination plays a significant role in diagnosis of disease. Nadi Pariksha is one among them, and it comes under Sparshendriya Pariksha. Aims and objectives. The conceptual study of Nadi Pariksha, to review its clinical significance, to study Nadi Pariksha in context of diagnosis. Material and methods. Synonyms of Nadi. Nadi, Dhamni, Dhara, Tantuki, Snayu, Jivanga, Hansi. Nadi location. There are locations. Vata, Pitta, and Kapha Nadi lies respectively under Tarjani, that is index finger, Madhyama, that is middle finger, and Anamika, that is ring finger, for examination. There are the locations. Three dosha and Nadi. There is relationship of three dosha with Nadis as follows: index finger, Vata, middle finger, Pitta dosha, and ring finger, Kapha dosha. Procedure of Nadi Pariksha. First, the best time of Nadi Pariksha is in the morning hours. Physician should be seated in comfortable position and in a healthy, composed mood, and rogi, like patient should have calm and cool mind also. They must sit in comfortable place facing each other. Vaidya must hold the rogi elbow gently with left hand and feel the pulse with his right index, middle, and ring finger kept in close opposition near wrist region. The nadi of right hand will be clear in males, while female that of left hand. Examine the pulse thrice by pressing and releasing technique, and diagnose the disease by using his intelligent power. Identify the Vata, Pitta, and Kapha pulsation at the index, middle, and ring finger respectively. And elicit its character like feeble, moderate, and fast, along with identify the character of various doshic pulse. Examination of pulse shed light on the involvement of Vata, Pitta, Kapha, mixing of two dosha or mixing of three dosha, or curable or incurable. Next, contraindication for the Nadi Pariksha. These are the contraindication, like just after taking bath, just after taking food, after internal and external anointing therapy, during hunger, during thirst, during sleep, or just after waking. Nadi Gati of dosha. The differentiating Nadi Gati, Vataj Nadi, it's like Jaloka Sarpagati, Pitta Janadi, like Kulinga Kaka Mandupa Gati, Kapha Janadi, Hansa Pravataka Gati, Dvandva Janadi, something slow and sometimes slow and sometimes fast Nadigati. Sannipata Janadi, Lava Titiravarti Gamanam. Swastha Nadi, healthy Nadi. How can we find the healthy Nadi? Pulse of healthy individuals is steady and forceful with normal rates and rhythm, character and symmetry. Hansa Gamanam, swan-like walk, and Gajagamini, elephant-like walk, and who is having happiness and freshness in the face is considered to be a healthy pulse. Asadhya Nadi. Displacement of nadi from its own place and move slowly and slowly. This indicates patient poor prognosis and patient will die. Next, feeble and cold pulsation definitely kills the patient. When nadi firstly pulsate like pitta jagati, afterwards it becomes like vata gati, then converting to kapha gati and moves like chakra, like wheel. Something it is rapid, sometimes it is rapid, sometimes manda. Such nadi should be considered as asadhya nadi. Nadi, sorry. Asadhya nadi, the nadi which resembles damru, a musical instrument which is strong at opening and ending, but the between which is very slow, it is mrityu suchak nadi and it indicates death in the day. Discussion. Nadi gati in nadi pariksha is appropriate pressure at various level of touch of 3 fingers, that is each finger felt different pressure due to dosha prabalyata, as Acharya explained it in various upamas from identifying gati of doshas or prabalya of dosha. Ashtavid pariksha includes nadi pariksha, has not been mentioned in Brihatraya, that is Charak, Sushruta and Ashtanga Sangraha earliest. Nadi pariksha is described by Acharya Sharangdhara but did not mention Ashtavid pariksha. Acharya Yog Ratnakar gave a detailed description about Ashtavid pariksha. Among them, nadi pariksha is one of the most important method of diagnosis as well as prognosis of disease in the Ayurveda. Conclusion. Diagnosis is the primary step before starting treatment of any disease. In our ancient Ayurveda, there are various types of diagnostic methods. Ashtasthana pariksha is the important tool to assess the roga and rogi bala. Nadi pariksha is one of the most significant method of the diagnosis in Ayurveda. On the basis of nadi pariksha, one can draw a conclusion on diagnosis of particular disease, can start management consequently. In present age, also there are many successful physicians which diagnose the disease only on nadi basis. Here are the references. Thank you.
Thank you, doctor. Next, I invite Dr. Priya P. Miskin. I invite Dr. Priya.
Yes, ma'am.
Doctor, please start.
Ma'am, can you keep my presentation?
Dr. Sabin, can you please share?
Dr. Priya, please start the presentation.
Yes, sir. Thank you, sir. Yeah, this is Dr. Priya Miskin. I'm from Rajiv Gandhi Education Society of Ayurvedic Medical College, Hospital and Post-Graduation Research Center, Roan. Today, I'm here to present my topic on Bheshaja Matra. Whenever we want to start any treatment for a patient, so Bheshaja Matra forms one of the most important factor to get the desired benefits of the disease. So the prime factor for treatment and the ultimate treatment for the patient is the Bheshaj Matra, which is very important. So this is the topic of discussion. That is the reason why I've taken this topic. So coming to introduction, Acharya Charaka has included Dravya or Aushadha in Chatushpada of Chikitsa and has told that a good knowledge about the drugs will help us to heal, whereas improper knowledge harms the patient or even can cause death. Apart from the knowledge about the properties of a drug, a good knowledge about the matra or the dosage schedule is extremely important. Yogadapi visham tikshnam uttamam bheshajam bhavet, bheshajam chapi duryuktam tikshnam sampadyate visham. As it is told, a sharp poison also becomes the best drug by proper administration. On contrary, even the best drug is reduced to sharp poison if administered badly. Hence, the wise person who is desiring for a life and a long life and a healthy life should not have any medication which has been administered by an irrational physician or a quack. So, yeah. Now coming to the definition of matra. Matra means it is a measure of any kind, quantity, size, duration, number, degree, etc. Charaka in his Matra Shitya Adhyaya described Matra in relation to intake of food as the amount of food without disturbing the equilibrium of dhatus and doshas of the body gets digested well as metabolized in proper time. Ahara Matra depends upon the Agni Bala and it is to be regarded as proper quantity, that is Matra. Chakrapani in his commentary described matra as either the ahara or aushadha. When taken in proper quantity, it produces good results. Also, it does not cause any undesired results when taken in proper quantity. Matra. So, na manena vinayukti dravyanam jayate kvachit atah prayogartam manamatyarchate maya. The success of treatment depends on dosage, time and proper administration, that is yukti. Every physician gives importance to these two factors, matra and kala, where matra is a prime one. Yata visham yata shastram yata agnim shaniryata tata aushadam vigyanam amrutam tata. Poison, weapon, fire and a thunderbolt. If one does not know the proper use, it can kill them. Similarly, a medicine known in respect of its name, form and properties, or even if known improperly administered, leads to bad consequences. If known, the medicine acts as a nectar. Acharya Charaka also mentioned regarding the proper administration of a drug. It is the matra only by which visha becomes amrita and vice versa. That is, aushadha becomes visha. So classification of matra according to Chakrapani Dutt, that is ahara matra, vyayama matra and aushadha matra. Aushadha matra is further divided into matravat aushadha and amatravat aushadha. Again, amatravat aushadha has been further classified into hina matra and ati matra. Hina matra will be unable to treat the disease, whereas ati matra will cause vitiation of disease leading to other undesired results, or it might also cause death. So next slide. Yeah, now let's see what are the effect of various factors on matra. So according to Charaka, the dosage is mentioned with reference to a person having moderate type of coaster, age and strength. Keeping this standard in view, changes in the dosage could be done according to the need, either by increasing or decreasing the matra according to the dosha, agni, bala, vaya, vyadhi, kosta. All these factors are helpful to decide the matra of an individual for better management. Okay, these are while compiling all the above references, matra can be decided only after considering the following factors as explained before: the vaya, bheshaja, kalpana, kala, prakriti, dosha, kosta, agni, sattva, bala, and the other factors which are going to affect the matra. These are a few basic bhasmas, that is the formulations and their dosages explained as per Rasa Tarangini. Yeah, according to the calculation of dosage in the modern, the various rules of dosage in which the pediatric dose was a fraction of adult dose. So these are few rules, and the age where the matra has to be given, that is Young's rule, which should be in less than 2 years patients, Cowling's rule more than 2 years, Fright's rule for infants less than 1 year, Dilling's rule and Clark's rule. Then coming to modern aspect, that is Beshaja Matra as told in Ayurveda is known as posology in modern. So the word posos means how much and logos means the study. So posology is a branch of scientific study dealing with the dosage. Dose is originated from a Greek word. Doses means the amount of a medicinal preparation to be taken at one time. There are different terms used for dose. That is divided dose, that is fractional portions administered at short intervals, lethal dose, that is fatal dose, maximum dose is the largest dose, that is safe for administration, and minimum dose is smallest dose that will be effective. Dosage is nothing but the amount of medicine is to be administered to a patient at one time. Next, coming to the discussion, to get maximum benefits of the Aushadha, one should have to consider the Atura Bala and Roga Bala before deciding the Aushadha Matra with the help of the Dashavidha Pariksha as been explained in the previous slides. As mentioned earlier, the dose depends on various factors like Desha, Agni, Bala, Kala, etc. Those factors were mentioned several years ago. They were very close to modern pharmacology parameters. As in modern pharmacology methods, they tell age and other factors, atmospheric factors and the tolerance capacity. It has been explained earlier by our acharyas as Vaya, Bala, Desha, Kala. It is equally important to ensure the difference between the two systems for developing and incorporating doses from a newborn to adult based on different rules and factors that are affecting the drug dose. The scientific approach of type of the drug, time and the route of administration, its different forms and its dosage and its regimen in Ayurveda are highly significant. Then coming to conclusion. Dose of Aushadha Dravyas cannot be fixed rigidly because there are so many factors which influence the doses like the condition of patient, severity of the disease, natural tolerance, acquired tolerance. Dose of the drug is to be decided by observing the Kala, Agni, Bala, Vaya, Prakriti, Desha and Dosha. So according to Sharangdara, persons of present era are with low digestive power, less tolerance and short lifespan. So the suitable dose of drug should be decided by the physician with his own intellect so that there will be no further complications and the desired effects for the treatment and the healthy life of the patient can be ensured. Thank you.
Thank you, Doctor.
Thank you, ma'am.
So, thus we come up to the end of today's session. Tomorrow we'll have the final session of presentation. So we'll meet tomorrow.
Dr.
Thank you all.
Aishwarya. Hello, Dr. Aishwarya.
Yes.
Doctor, next I would
Yes,
like to invite Dr. Priyanka Chavan for the paper presentation.
Hello, sir.
Hello, Dr. Priyanka.
Yes, sir, I am here. Sir, please share my
Okay,
presentation.
1 minute, doctor. I will share for you, doctor. 1 minute. Doctor, please start the session, doctor.
Good evening, all. My name is Dr. Priyanka Chavan, PG scholar from Department of Kai Chikitsa, SMBT Ayurvedic College, Nasik. Today's my paper presentation topic is etiopathogenesis of Pandu Roga with special reference to iron deficiency anemia. First, we see the abstract. In this disease, there is predominance of paleness all over the body. Due to its similarity, it can be correlated with modern disease anemia. Pandu Roga is explained by almost all of Acharyas. Rasavaha and Raktavaha Srotas are chiefly involved in pathogenesis of Pandu Roga. The changing lifestyle of human being by means of Ahara and Vihara plays a major role in manifestation of various diseases. Pandu Roga is also one of them. Our faulty dietary habits and lifestyle produces ama, which further causes Agnimanda and ultimately Amayukta Aharas produce. It hampers Rasadhatu Utpatti and manifests Pandu Roga. Aggravated Pitta is responsible for the production of Poshak nutrient portion from the Rasadhatu. As a result, depletion of Rakta takes place. The detailed knowledge of Nidan Panchak and types of Pandu Roga will help in its diagnosis and management in this modern era also. After that, we see the introduction. Rakta has been considered as one of the dhatu, a key factor for the Jivan, Prinan, Dharan and Poshan karma of the body. Many a times it is seen that Rakta gets vitiated by doshas, mainly by Pitta dosha, as Rakta is Pitta Vargya and disease like Pandu appear. There may be various modification of color such as Harid, Haridra in the disease condition described under the Pandu Roga. Pandu is Pitta Pradhan and mainly Rasa Pradoshaj Vyadhi. The main nidans are Atisevan of Kshara, Amla, Lavan, Ushna, Viruddha and Asatmya Ahar. The word anemia in Greek means a lack of blood. Actually, it is a deficiency of hemoglobin and there are various types of this deficiency. The commonest type of anemia observed is iron deficiency anemia. Anemia can result from a large number of causes, including nutritional deficiencies, acute or slow loss of blood due to trauma or diseases, destruction of red blood cells due to various metabolic and immunological abnormalities or toxins, diseases of the bone marrow, general systemic diseases like infections and various varieties of cancers, kidney failure, etc. Nidan of Pandu Roga. The general etiology and Samanya Nidan of Pandu Roga is described in Charak Samhita, which all factors mainly related to Aharaj, Viharaj and Nidanarthaka Roga. Pandu Roga is considered as Pitta Dosha Pradhan. The provoking factors of Pitta can also be taken as a cause of Pandu Roga. Nidan of Pandu Roga can be classified into following three categories. First one is Aharaj Hetu. In this, Amla Atisevan, Lavan Atisevan, Vidagdha Bhojan, Mruda Bhakshanam, Pitta Satyapan, Viharaj Hetu, Ati Nidra, Ati Vyayam, Ati Vyabhay, Krodha, Kama, Ratri Jagaran. In Vyadhijanna, Grahani, Lihodar, Rakta Ati Pravartan, Rakta Kshay and Rajayakshma. Samprapti of Pandu Roga. There are two types of Samprapti, Samanya and Vishesh. According to Charak, excessive consumption of Kshar, Lavan, Adhik Ahar, Vihar, Nidan Sevan leads to the Pitta Pradhan Dosh Prakop of Rakta vitiated Pitta in the Hruday due to Kupitavat gets expelled out of its sthana and enters the Dashadhamis and spreads throughout the body and gets settled in between the Tvacha and Maunsantar and does the further vitiation of Kapha, Vata, Tvacha, Rakta, Mausa and manifesting into the disease Pandu Roga, which shows the Pandu. Harita, Haridradi Vivarnata of Tvacha and also shows the Lakshanas like Alparakta, Meda, Nisarata, Shitilendriyata, etc. Lakshanas. Samprapti Ghatak. Dosha, Pitta Pradhan Tridosh, mainly Sadhak Pitta. Dushya, all dhatus including Ojdhat. Agni, Jatharagni and Dhatavagni. Srotas, Rasavaha and Raktavaha Srotas. Srotodushti, Vimargagama. Udbhavasthan, Amasha and Hruday. Sancharan, Sarva Sharir. Vyaktasthan, Tvaka and Vyadi. Swabhav, Chirakari. Rogmarga, Madhyam Rogmarga. पूर्वरूप of पांडुरोग, हृदयस्पंदन, palpitation of heart, वृक्षता, स्वेदाभाव, त्वकस्फुटन, गात्रसाद, मृदभक्षण, प्रियक्षकुटशोथ, विनमूत्र. रूप, दुर्बलता, अन्नद्वेष, श्रम, भ्रम, हृदप्रभा, irritability and शिशिरद्वेषी. भेद or types of according to चरक. वातज पांडू, पित्तज पांडू, कफज पांडू, सन्निपातज पांडू आणि मृत्तिक भक्षणजन्य पांडू. Discussion. Pandu is a rasa raktavah SROTAS vicar in which paleness of skin, nails, eyes, face, etc. are seen and lakshanas like alparakta, alpamedasa, balahina, varnahina, alasya, nissara, diminished sensory and motor activity, lack of enthusiasm, etc. are found. Pandu rogi loses luster and become victim of dryness of body. Balakshaya and Ojo Gunakshaya are also seen in Pandu rogi. It is Pitta Pradhana Vyadhi and involvement of other doshas. Charak describes skin color in Pandu like Harita, Haridra, Bahuvida Varna, Krishna Pandu, Arunangata, Shvetata, and Shweta Bhasata. Panduta of Danta and Nakha is told in Shusruta. Shweta, Akshi, Nakha in Pandu is mentioned in Kashyap Samhita. Hruday Spandanam as the Purvarup of Pandu told in Ayurvedic classics can be equated with the symptoms palpitation told in anemia in modern medicine. Other symptoms like Rukshata, Svedabhav, Shrama, Mrudabhakshan, Akshikutashodha, Avipaka are seen in Pandu. Rukshata is seen in Pandu because of Rasadhatu Dushti and Tvaka is the Upadhatu of Rasadhatu. As Medovah Srutas and Raktavah Srutas are involved, symptoms like Svedabhav, Shrama are given in Pandu. Akshikutashodha may be papilloedema, told in anemia and angular stomatitis. Avipak is a major symptom in moderate anemia. Usually people will not take mud for eating, even though it is mentioned as a type of Pandu, mostly due to unhygienic conditions and contaminated foods. Various types of parasites enter into the body and absorbs food and nutrients. Especially hookworm sucks directly blood from the human being and it is considered as major cause of iron deficiency anemia in undeveloped countries. Panduta or pallor can be considered as the Pratyatma Lakshana of Pandu. Acharya Charak has mentioned Arova Asai as the Vishesh Lakshana of Pandu. Raktalpata can also be considered as the Pratineta Lakshan of Pandu. Both qualitative and quantitative decrease of Rakta is seen in Pandu. Discussion of Samprapti of Pandu means the assessment of various Nidan, involvement of Dosha, Dushya, Srotas, Agni, etc. Acharya Charak considers Pandu as a Rasa Pradoshaj Vikar and Sushrut considered it as a Rakta Pradoshaj Vikar. But both opine the major involved dosh is Pitta. In our classics, it is explained that Ranjak Pitta gives color to the Rasa Dhatu and helps to form the Rakta Dhatu. Due to the Nidan, when the Pitta Vruddhi takes place, especially the Dravatva of Pitta dosha gets aggravated and further it subsides the Jatra. The vitiated dosha got sthana samashtra in Tvaka as it is the Upadhatu of Rasadhatu. Chirotpanna Pandurogi is asadhya due to of the extreme loss of ojas resulted due to the dhatuksha. Conclusion. Based on Nidan and Lakshan, Pandu can correlate to iron deficiency anemia of modern science. Pandu Roga shows its direct impact on Rasa Raktava Srotodushti Lakshanas due to Rasa Dhatavagni Manjata. Vata Pitta Prakriti person and those who follows Pittakar Nidan persons are more susceptible to Pandu. Present lifestyle that has disturbed the food habits, giving rise to Agni Mandya, Vidagdha Jirna, and finally leads to Pandu Roga. Poor socio-economic condition, mental stress, and strain play an important role in causing and aggravating the Pandu Roga. Married people were more prone with the Pandu Roga due to their excessive physical work and strain leads to Pandu Roga. Pandu Roga is a Pitta Pradhan Vyadhi with the involvement of Vata and Kapha dosha. In acute stage, all Pandu Roga are curable and manageable, but in chronic stage, they are incurable. The study of Nidan Panchak will helpful in accurate understanding of Nidan, Purva Roop, aggravating factors, relieving factors of Pandu Roga. These are the references. Thank you.
Thank you, doctor. So, Dr. Nigel, are you there? So, Dr. Nabeel?
Yes, madam. Am I audible?
Yes, yes.
Okay, I will share my screen. My PPT is visible, madam.
No.
I shared it. Is it visible now?
Doctor.
Not visible, doctor.
So you can display, sir.
Doctor, I will share for you, doctor. Hello, doctor.
Yes, sir.
I will share for you, doctor. 1 minute.
Okay, sir. Thank you, sir.
Doctor, is the screen is visible, doctor?
Yes, sir.
Okay, doctor. Please start the session, doctor.
Okay. Thank you, sir. I myself, Dr. Nabeel Ashar, PG, Rachanachari, final year student, Arati Ayurvedic College, Akola, Maharashtra. Now I will start my PPT. My topic is study of MOOLASTANA of SUSRUTHOKTA PRANAVAHA SROTAS with special reference to modern anatomy. Abstract. The concept of SROTAS is described in Ayurvedic literature. One among the SROTAS is PRANAVAHA. So we will have discussion on PRANAVAHA SROTAS, and VRIDDHI and Rasvahi Dhamni are considered as root place of PRANAVAHA SROTAS as per Sushruta Samhita. Similarly, heart and related blood vessels are considered to be the basic anatomical structures of cardiovascular system. In the present work, a comparative study is done between Sushrutokta, Pranavasthota, and anatomy of heart and the related blood vessels and its applied aspect. Next. Thank you. Introduction. Ayurveda. Mostly I will describe the important part. The thing we are going to discuss in this PPT is that Pranavasthota, Hridaya, Rasvahi Dhamni are considered Moolstan. And now, due to changing lifestyle, lack of exercise, fast food consumption of tobacco, there is great increase in cardiac diseases in the entire world. Ischemic heart disease is one among the highest cause of death, not only in India, but also in the rest of the globe. Hence, there is need to study the anatomy of heart and Rasvahi Dhamni, that is the blood vessels of heart, and the diseases related to the heart. An effort is made by this study uh, to study the anatomy of heart and blood vessels, symptoms, and the procedure. Mainly the procedures done in the treatment of coronary artery disease. Next slide, sir. Thank you, sir. Materials and method. Sushruta is considered as the basic Ayurvedic literature for this study. Similarly, for modern, it is British Orasi and Gray's Anatomy. Now, Ayurvedic view. Definition. Srotas is defined as hollow organ of body which is responsible for circulation of rasa. Types of srotas. The word srotas means a channel or canal. Srotas are of two types, Bahirmukh and Antarmukh. Now, in males there are 9 and in females there are 12 Bahirmukh srotas. And there are 11 pairs of Antarmukh srotas. They are listed below. First one is Pranavaha srotas. And as are also mentioned here, Annavaha, Udapvaha, Rasavaha. Next slide. Pranavaha srotas. Pranavaha srotas is described in Sharirachna. They are 2 in number and Moolstan, Hridaya and Rasvahi Dhamni or Pranavahi Dhammi. Now, we are studying the Ayurvedic part. Here the location in Ayurvedic literature, Hridaya is located to sun. That is, Hridaya is very close to Amashaya, hence it's called as Amashaya Dwara. Characteristics: externally, Hridaya looks similar to Pundarik. Pundarik means lotus flower, placed in upside down position. Now, we will Rasvahi Dhammi. The origin of Rasvahi Dhammi is Hridaya. There are 24 Rasvahi Dhammi in human body which provide nourishment to the entire body. Now, Vidya Lakshana are also mentioned here. That is Akrosh, Mohanam, Vipanan, Vinama, Brahma, and Maran. Next slide. Now we will see the modern view. Anatomy of heart. The heart is a conical hollow muscular organ situated in the mediastinum. Heart is enclosed within the pericardium, and heart is obliquely placed in the body. The heart measures about 12 centimeter in length and 9 centimeter in breadth. Its weight about 300 grams in males and 15 ml. External features. We will see in short. There are external features. It comes grooves of sulci. There are 3 grooves. Apex of the heart. Apex of the heart formed entirely by the left ventricle. And in the living subject, pulsation may be seen and felt over this region in the base of the heart. That is, base is called as posterior surface. Next slide. We will see the border. There are 4 borders: upper border, right border, inferior border, and left border. And surfaces, 2 surfaces are anterior surface and inferior. Walls of the heart. There are 2 pairs of walls. That is tricuspid wall, that is right AV wall, and bicuspid or mitral wall, and also semilunar wall, aortic wall, and pulmonary wall. Conducting system. The conducting system is made up of myocardium, that is specialized for initiation and condition of the cardiac conduction of the cardiac impulses. The conducting system has the following parts. That is conducting system. That is mainly the SNO, that is called as pacemaker of heart, and it produces 70 beats per minute. And AV produces 50 beats per minute. And another conducting system, bundle of hairs, that is the muscular conducting between the atrial and ventricular musculature and the Purkinje fiber. It forms the subendocardial plexus, which are fine and pale fibers, and the arteries of the heart. There are mainly 2 arteries, that is RCA, that is right coronary artery, and the LCA, that is left posterior aortic sinus. Next. Now, veins of the heart. The main vein of heart is coronary sinus, and it is 3 centimeters long. And more veins are anterior cardiac veins, which are 3 to 4 small veins, Sebacean veins, and there are small veins present in all the 4 chambers. Now, important blood vessels are related to heart. Now we see the pulmonary trunk. Pulmonary trunk is right. It is pulmonary trunk is divided into right pulmonary artery and left pulmonary artery. Right pulmonary artery passes to the straight, which passes to the straight posterior to the ascending aorta and superior vena cava to enter the right, and the left pulmonary artery, that is, which passes inferiorly to the arch of aorta, descending aorta to enter the left lung. Next slide. Now we will see the second one, aorta. Now 3 parts of the aorta: ascending aorta, arch of aorta, and descending aorta. The origin of ascending aorta is the aortic orifice at the base of the ventricle, and arch of aorta moving superiorly slightly forward and to the right, and the descending aorta that begins at the aortic arch and the abdomen. It's further divided into parts, the thoracic part and the abdomen. Next slide. Now pulmonary vein. Pulmonary veins carry oxygenated blood from lungs to the left atrium, and there are 2 from each lung. That is superior vena cava and the inferior vena. Superior vena cava passes through the fibrous pericardium approximately to the level of the second posterior cartilage and enters to the right atrium, the lower level of the third posterior cartilage. And the inferior vena cava after passing through the diaphragm, approximately the level of water pH. The inferior vena cava entrance the fibrous pericardium. A short portion of this vessel is within the pericardial sac before entering the right atrium. Next slide. Now we will start the applied anatomy. Here, wall disease, mostly two basic types, incomplete, that is insufficiency, and second one is stenosis. Now, mitral wall disease, basically are of that is mitral wall disease is usually a mixed pattern of stenosis and incompetence. And the second one is aortic heart disease. Both aortic stenosis and aortic regurgitation it is that can produce mass heart failure. And the third one is common congenital heart defect. The most common congenital heart defect caused by the defect in the atrial and ventricular septa. Next slide. Now, the congenital heart diseases, main one that is seen is ASD, that is atrial septal defect, and another one is ventricular septal defect. The defect in the interatrial septum allows blood to pass to one side to the heart, to the other from the chamber with the higher pressure. This is clinically refractory. And now ventricular septal defect. The most common of all congenital disease defects are those that occur in the ventricle, that is VSD. So you can say that VSD are the most common heart disease, congenital heart disease. And the third one is patent ductus arteriosus. Occasionally, the ductus arteriosus, which connects the left branch of the pulmonary artery to the anterior aspect of the aortic wall, also close the side burst. So it leads to pulmonary hypertension. Next slide. Now, we will see the diseases that are discussed that are related to heart disease. That is myocardial angina or pneumonia, angina pectoralis, called as myocardial ischemia. Pain is usually red for color and location and brought by exertion. So we can say this compared to myocardial infarction, pain of angina pectoralis is less severe, and myocardial infarction that is most dangerous and is the most that is cause of death in entire world causes. Other common physical signs that include of myocardial infarction that are sweating, cyanosis, hypotension, arrhythmia, pericardial friction, rub, pantocyclia, PCF, and the cardiogenic shock. Next slide. Now we will see the coronary artery disease. Occlusion, that is blockage of major coronary artery, leads to inadequate circulation area of the myocardium and the cell death. So, the severity depends on the size and location of the artery involved and whether or not the blockage is correct. Now, there are mainly two main procedures to treat this coronary artery disease. One is coronary angioplasty, that is also called PTCA. It is a technique in which a long fine tube, it is a catheter, is inserted into the femoral artery in the thigh, passed through external and common iliac artery and into the aorta, to the origins of the coronary artery. A fine wire is then passed into the coronary artery and is used to cross the stenosis. As the wire passes, a fine balloon is passed over the wire and inflated the level of obstruction, thus widening it. So, if small blockages are there, it can be treated by coronary angioplasty. But if there are severity more, then we have to go for CAB, that is coronary artery bypass graft. In common term, we can call it bypass. If the coronary artery disease is too severe to be treated, the coronary angioplasty, surgical coronary artery bypass grafting may be necessary. We will see the process in that. The great saphenous vein in the lower limb is harvested and is used as an autologous graft. It is divided into several pieces, each of which is used to bypass blocked sections of the rotary artery. The internal sorry, the internal thoracic radial arteries can also be used for the purpose. Next slide. Now, we conclude. In the above study, we have seen that the location of Hridaya described in sequential same as that of heart in modern anatomy. The Rasvahi Dhamni originates from heart, as described in SUSRUTHOKTA. From this study, we can conclude that the Pranavahas described in Sujata can be correlated to CVS of modern anatomy. Now there are references. So, thank you.
Thank you, doctor. So it's an official end. Thank you all. We'll meet tomorrow.